Good morning, the Ridge Medical Practice. Vicky speaking.
I got bitten by a dog yesterday.
OK, right.
And he drew blood.
Where is it most sore?
It's hurting in here.
You're such a brave boy.
I lost my husband in end of May. He went in and he didn't come out.
Must have been a shock.
Traumatic. Yeah, it is a shock.
Have you ever had trouble with your breathing before?
Yeah, but not as bad as
Not as bad as this. OK, all right.
If I show you pictures of poo on my phone, if that's OK.
How are you feeling about what happened?
Paranoid. Really paranoid.
Yeah. Morning, Ebony.
Morning.
Leonie. Oh, my God.
I'm Susan Towers, a GP, but with an interest in skin problems, so that's why your doctor sent you
I
here.
hope you can help me.
So you didn't have any problems with your skin as a child?
On and off.
What did you have?
Patches of eczema, but then more recent, I've had outbreaks like all down my back, all down my legs, and the biggest problem is my ear. I've had that ongoing for over 12 months now. Antibiotics, cream, steroids, anything, and it's just not helping.
Is there any reason why you can think that might have happened? Your job, for example, or any hobbies?
I'd say maybe stress-related. I think age thing, getting older.
You perhaps stress more because you know there's more to worry about, don't you, maybe?
Yes. I've had poor mental health, so I've just been getting myself more well.
Right.
So focusing on my mental health, going to support groups and stuff.
OK.
I've been using hydrocortisone ointment on my ear. It itches, so in the night I'm waking up and my ear's on fire, so that's what's been bothering me more lately. This is really bad.
Oh, that's nasty, isn't it? Do you colour your hair?
I have dyed it, but I haven't had hair dye in the ear.
It is leaching out slowly over time, that's why it fades, and so it can irritate you if you're sensitive. Can I look at, what did you say, your legs are bad?
What they are on my legs is more scars.
Let me pull this round.
Yeah. These are the recent ones that I've just scarred.
OK.
I say they're like cigarette burns.
Yeah, you do have a spotty type of eczema, which some people have.
And these are my old
Marks from
scars.
previous, yeah.
But this is why it's bothers me, because it's come back again. No, it's scarring me. I'm not sure if you can see if there's any on my back still, but normally I get them all over my back.
Oh, there is. Okie doke, thank you.
Come and take a seat. So this is a new chap, is it?
Yeah, we're engaged now.
OK, so you missed your appointment yesterday for your B12, is that right?
We got it in the wrong place, didn't we? We slipped up, didn't we?
Anyway, let's see when your last one was.
You won't know anything about diabetic, will you? Do you?
Want to know, yes?
Oh, well, we've come to the right place.
Yeah. Well, I did my blood this morning and I was 17.7.
OK. What is it normally?
One day last week, it came up to 22.
Anything changed in your diet?
No.
You're not having more cakes, biscuits,
She's
chocolate,
been
anything?
No, I've been
eating a few sweets, but...
I've been eating a few, but not a lot.
No.
It's telling tales on you.
I know. Because we go shopping and, oh, a bag of sweets goes in straight away.
I wonder who's putting the sweets in that...
Me.
OK. So just be careful with those.
Yeah, well...
Yeah.
Right.
OK, love, yeah.
Shall we do your B12?
Right.
Where do you normally have it?
Either my left or my right.
Do you think this injection now might bring a blood test down a bit?
This is not going to have anything to do with glucose levels, no.
No.
So this is like iron deficiency.
Yeah.
I
So
see.
she might get a bit more energy.
Yeah.
I could do
She's
with
full
some...
of energy.
Is she?
We go cycling.
Good.
I went cycling yesterday and I fell off on my bike, look.
Oh, keep an eye on that.
Does it need out on it?
OK.
We're
but
putting Savlin on, aren't we?
If it gets more red, more hot, and any swollen, come back and get it checked. But keep it clean.
Right.
Right, shall we do it in your right arm?
Right.
OK.
There goes.
So relax your arm down, OK? You know it stings a little bit, don't you, when it
Yeah,
goes in?
it does, yeah.
Look at you, fella. Sharp scratch. It's all right, nearly done. All done. Okie doke.
Thank you very much.
Today. You're welcome. Nice to meet you.
Yeah, nice to meet
Yeah,
you.
and you.
Oh, yeah. She's not just a pretty woman, eh, love?
We'll see you again, love.
See you
Right,
later.
bye, love.
Bye.
Your skin surface is supposed to be like a brick wall. With
Yeah.
the bricks are your skin cells and then the cement in between them. And people with eczema tend to not have quite as good cement as people who don't have eczema.
Okay.
That means the bricks fall off more easily, so your skin tends to be a bit drier and flakier.
Yeah.
You lose water through the gaps, but also things can get in. When something gets through those little cracks and irritates, it irritates you a lot more than it would irritate somebody without eczema.
Yeah.
And that's why steroids are needed, OK? Because they suppress the inflammation. But we don't want to keep using steroids because they're going to damage your skin.
Yeah.
That's why I've got to prevent with lots of moisturiser.
Is it common that? Because people think I've got flea bites and stuff. I've never seen it before.
Well, I've seen it like that. Some people do have a spotty type of eczema.
And why have I only just started getting it?
Stress always makes things worse. We know it affects your immune system.
Right.
Maybe when you weren't so well with your mental health, you didn't look after your skin as well as you do
true,
now. I don't
yeah.
know. It's a
Suppose,
combination of
yeah.
things usually. But anyway, now you've got to start.
Yeah,
again.
definitely. Better than you fobbing me off, really, because I was thinking it just weren't curable.
It's not curable, it's controllable.
Yeah. Lovely.
So you've got 2 tubs of moisturising cream, so that'll last you 2 weeks. I've given you this quite strong cream called Cinelar C. I've given you loads more than I think you'll need, actually. It should be loads better within a couple of weeks.
There's hope, isn't there?
There's definitely hope. You're going to get better.
Yeah,
promise.
thank you very much. Thank
You're welcome.
you.
We have a big problem with his willy with foreskin. Last couple of days he was complaining that it hurts.
Yeah.
And that he feel the pain when he doing wee. And yesterday at school he fell over and he squashed it somewhere. I've been asking him if it was hurting before he fell over.
Yeah.
He said yes, yes.
Yes, OK. Right, let me have a little look at you. Well done.
He come to me yesterday and tell me, Daddy, I have a little problem. Pull his pants down, look, he's swollen and bigger and getting bigger and bigger.
Poor thing. OK, so it's slightly up now. Right, over here onto this little
Chodź,
thing
pani
here,
Sikorka,
all right,
obejrzy
sweetheart?
rybcia.
Over you come. There's a good boy. All right, then.
Oh, that side is worst.
Is it uncomfortable?
It is hurting.
It's hurting.
I think he squeezed somewhere here, or is it infection or something?
It does look a little bit infected, doesn't it?
Yeah.
I agree. I'd like just pop his things back up for a moment. I'm going to ask Dr. Keris to take a little look at him because that's sort of, well, it's obviously tender, isn't it? All right, I won't be a moment.
Okay.
But it looks like bruised at the base of his peen, like really bruised.
Really?
Like, because they said it was really swollen up.
Okay.
And I thought that doesn't look normal.
Right.
So.
Okay, sure.
I don't know if I've been bitten on my eye by something. It's just literally swollen my whole eye up.
And 2 evenings ago, I sat out on 10:15 when it just getting dark. I got bitten by insects.
We're in garden. Chris stood on a wasp's nest. His whole body's covered in wasp stings.
Whatever it was flew on, bit me there, and carried on its way.
Well, I came in last night because I'd been bitten. It happens this time every year.
Oh, no. I keep getting bitten by something everywhere, look. I've had one there and one there, but I don't know what it is. It's proper doing my head in.
Right.
I got bitten by a dog yesterday.
OK, right.
And he drew blood. And the police suggested that I come to see the doctor.
OK, so tell me what happened.
I'm walking down the road and there was this woman standing by the car, husband standing there and her son with a dog on the lead, a little rat on the lead, yeah?
OK, yeah.
Suddenly just jumped up and bit me through the leg.
Right.
But I was more shocked.
Yeah, of course.
I mean, I love dogs. I've had dogs all my life, but I've never, ever been bitten by one.
The vast majority of dogs are beautiful, nice animals, you know. Right, shall we have a look at it?
Yeah. I don't think I can get it out far enough.
It's all these new trendy pants that are all tight at the bottom.
Yeah, look. Oh, I might.
Right.
It actually hurts.
Yeah, I bet it does, because it's bled underneath as well, which is that bruising that you can see there.
That really hurts.
Right, there's a couple of things we need to do. Because he's broken the skin, we need to give you antibiotics.
Yeah.
Any bite that breaks the skin, we give antibiotics for.
Yeah.
We need to give you a tetanus booster as
I
well.
haven't had one of them for a long time.
Yeah,
Okay.
I need the top of your arm for that, so if you can just...
Take me jump.
Yeah. Are you allergic to anything?
Not that I know of.
So this will protect you against tetanus for the next 10 years. So
Okay,
that's-
thank you.
Right, just a sharp scratch, sorry. We're all done. That's
Thank you very much.
No problem. And a course of antibiotics to take for 7 days. It's certainly not infected or anything now.
That's good.
It's just about protecting it from getting infected and protecting you from tetanus. 4 times a day for a week. That's you sorted.
Thank you very much.
All right, nice to see you.
And you. Thank you
Ooh.
very much.
See you later.
Bye.
OK, I've got Dr Caris in to take a look
Hi.
at Philip as well. All right.
Right, so what's happened then today?
He got that problem with the foreskin.
Right, tell us a bit about it. What happened at school then?
I was running, then I fell down.
You fell down? Yeah. OK. Oh, did you land on someone's leg or someone's knee? Maybe. Yeah. We've got to make you feel a bit better, haven't we? Yeah, what do you reckon? Should we have a little look at you? Are you able to sit down? Right. Can you pull the skin back yourself? Is it going to go back? Show us what you can do. OK. Right, there's some bruising. Just, right, yeah, a little bit. OK. What year are you in at school then? What class are you in?
Year 1.
Year 1. So how many teachers have you got?
2.
2. Right, can I have a little look down here, see if we can make it feel a bit better?
Yeah.
You're a good lad, aren't you? Where is it most sore? It's just all over, isn't it?
It's hurting in here.
It's a bit swollen, isn't it? OK, you're such a brave boy. OK, did anybody kick you today?
Yeah.
Who kicked you? It's OK, you can tell us what really happened. It's absolutely fine.
Someone kicked me and then I fell over.
OK, where did they kick you? In this bit?
Yeah.
Pull your things up, OK. I think you're the bravest Year 1 boy I've seen today, definitely. Definitely. Right. I think probably he's been kicked there and that's flared things up a little bit and it's all a bit swollen and that's aggravated the problem. He has got a tight foreskin and he may well benefit from a circumcision at some point, you know, where they remove the foreskin to allow it a bit easier.
I'll do a referral and they can discuss it with you about whether to do it straight away, to wait and see.
You've been ace. Yeah, such a brave boy. Because he's able to pee, we think we probably need to give him some antibiotics to try and help settle that down. You may be more comfortable sitting in the bath, trying to pee in the bath, you know, things like that. Okay. Is that all right?
Thanks for the
all
help,
right,
yeah.
I'll leave you in very capable hands.
No, OK, thank you.
Any questions?
No, I think we know everything.
Yeah, there we go then.
All right, thank you.
You're welcome.
Bye-bye.
Bye-bye.
All right, see you, bye.
OK then. Bye.
Leoni-Jayne medical practice, Dawn speaking. I'm afraid our system has crashed at the moment. We're not able to do anything. I think it would be the same at our other surgeries as well, yes, because we all use the same system. We are advising people if they could call back in about an hour or so. No, I'm afraid I can't do anything because none of the doctors can get onto the system either. I can't physically get onto the computer to see the appointment system. I would advise you ring 111. As I said to you, before the systems went down, I knew that all the appointments for this afternoon had been fully booked. I'm really sorry, but there's nothing I can do because there's no system. The only option would be to ring us in the morning to try and get an appointment then.
Dorina. Hiya. Come on down.
A bit faster. You know, I feel a bit...
You're still walking quickly enough, though, aren't you? Hey?
Do you know, Dave, I can't.
Yeah? What's been the matter?
My feet
Yeah?
here. when I put in the morning, put me here,
Yeah.
it feel like a sponge.
So is it tender?
Oh, yes, even the painkiller doesn't kill it.
If I press there, is that where it's Yeah. It probably is fasciitis where...
Yes.
It's where the arch drops a little bit.
Yes, but it's the other foot as well, just the same.
Yeah, it's often the same on both feet. Yeah. What commonly happens is if we look at your foot sideways on,
yeah,
that's your heel bone,
yeah,
and those are the bones going to your toes. You'll have this strong,
yes, there.
this strong tendon that goes along
Yeah.
to form the arch of your foot. And what that tendon does, sometimes it flattens out and it pulls on the bone here and it causes an inflammation of the tendon and around that heel bone. That's the thing that's painful. Yeah. What you can do is buy some supports that support the arch.
Oh, my son's bought me
Yeah.
two.
And the other thing you can do is you can give an injection to that area.
Oh, no, then I shall try with that.
Do you want to try with that for another few weeks?
But see how thing goes.
OK. So you were telling me last time about... Because when we're going down to see my son...
Yes, he's still down there, isn't
In
he?
Sevenoaks.
In Sevenoaks.
Yeah.
It used to be beautiful, but it wasn't very populated. I remember in those days, but it was beautiful, clean, part of the countryside.
And why were you down there again?
Because I had relation everywhere.
So you were a guest of Mary Soames,
Yes.
who was Winston Churchill's daughter.
First daughter.
And used to go and stay?
Yes, because Auntie, she was the top chef for them.
What year was this? Was it...
In 1954.
Yeah.
Because Winston used to say, oh, Bradford is very dark.
So we'll wait and see how you go with the padding.
Yes.
Another 3 or 4 weeks.
3 or 4
Still
weeks.
struggling. We'll reconsider possible injection.
Well, I'll try anything.
Yeah? OK.
Thank you very much for everything. And you look after yourself.
And we'll see you again if you're struggling still with
because
this.
I'm getting old. But no, not
You're still great. Yeah.
Keep on going.
See you later, dear. Bye-bye.
Did you see me at when I was 14? And I thought I looked like a right stunner. I went to my sister's anniversary and she had the album out. That's what I thought to myself, oh, you looked pretty not bad.
Even though you say it yourself?
Even though I say it myself.
That tall, weren't you?
I know, I was actually tall.
Oh, it still looks like you. You have changed a bit.
That's me, yeah. And then look at this.
Yeah, you still, I'm sorry, but you still look good. You were, what, 14 there?
Yeah.
Yeah. You should have seen me up when I was 14.
No, I can't imagine you being chubby at all.
Come on in, have a couple of seats. I'm Dr. Caris. Right, this is Angela, is it? Who have you got with you?
I'm an auntie.
Auntie Linda.
Yeah, they live with me and my husband.
All right.
Mum died.
All right, OK. Right, what's going on?
I can't struggle to breathing ever.
All right, OK, when did...
She's been on it for nearly 5 weeks now.
5 weeks, all right.
And
Because
she's got inhalers and she's using them, but they're not touching her.
Oh, really? Right. OK, so which inhalers have you got and which ones do you use?
I use that one at night and morning. And that one during the day when I need.
OK. Let's check you out then. Have you had your inhalers today?
Yeah.
And have you ever had trouble with your breathing before?
Yeah, but not as bad as
Not as bad as this. OK, all right. Right, let's pop this on one of your fingers, eh? And how do you feel in yourself now?
Just a bit breathless.
A bit breathless, yeah. Because your oxygen level's very good, 99, and your pulse rate is OK. Can we have a quick listen? Is that all right? Able to stand up, eh? I'm just going to have a little tap first, OK? Feel a bit warm, don't you? OK. Just have a wee listen down here, don't mind if I just... OK, that's fine. Have a seat. So, I mean, listening to your breathing, it's very clear. There's no sign of any tightening or asthma there. Your numbers are very good, and clearly you're struggling a little bit. And I just wonder if that's more sort of an anxiety, panic attack type of thing rather than a flare-up of the asthma. our brains control our body, as you know, but sometimes they can sort of go into an override, if you like, and certain things, sometimes for unknown reasons, can start making us feel a bit edgy and a bit anxious. And I think that's probably what's going on. Has anything happened today at school, or that's maybe could have made you feel a bit anxious and things? No. Yeah, panic attacks, they are very common, much more common in ladies for some reason, much more common in sort of your sort of age group, if you like. And it maybe is because there's a lot of changes going on, but also there's a lot of sort of emotional stuff going on and difficult to manage sometimes. There's a phone number we can give you that you can ring, and you can get access to someone who can talk a bit about it. Would you like to do that? I think that's probably the best option, isn't it? All right, any questions from either of you?
Thank you.
All right. OK, we'll get you sorted, no worries. All right. See you later.
Come in. Hi, Mr. Arnott. Come in, I'm Dr. Khan. Come and sit down.
Nice to meet you.
How can I help?
So, Saturday, I went for a drink, went down to Tesco's, went to go buy some more beer. As I was down there, a group of lads ended up chasing me.
Right.
I must have done a good 5-6 miles of proper sprinting, running for my life kind of thing. I've really damaged both my calves, like to the point where I woke up this morning, I couldn't get out of bed.
OK, so now tell me about the leg.
I struggle standing up, walking around.
Yeah.
It's just, it feels like constant cramp.
OK, both legs or just one?
Both.
Right, and whereabouts?
Like, all my calf.
All along there?
Yeah.
And you ran for how long do you think you ran
for? A good
for?
5-6 mile running for a good couple hours.
And for a couple of hours?
Yeah.
Right. We'll have a look at your legs and sort that out. How are you feeling about what happened?
Paranoid. Really paranoid.
Yeah.
Oh, thanks, Vicky. Just what it was.
Where would you like me to leave it?
Could you leave it just there? It's going to look at me all morning and remind me of apple juice and remind me to drink.
You've not suddenly started passing stools into your pants?
No.
Is there any blood in your poo?
No.
Heidi's been having quite sort of mucousy poo.
And is it like watery or soft?
It's watery. It smells horrible.
Is like a child's poo supposed to be black?
Going to the toilet OK?
Going to the toilet a lot.
Not been any blood in your poo?
Are they hard, soft, normal?
Carry a bag full of poo.
Her poos are just not formed.
Hiya.
Guess I got you.
Moppy.
Go in there. Come in. Hi, honey. Please take a seat. So my name's Dr. Eunice. I'm one of the GPs working here. This is Angelia and your mum?
My name is
Amber. Yeah, hi, Amber. How can I help?
She hasn't been very well. I think she complains a lot about stomachache all the time.
Where in the tummy are you having the pain?
In the middle.
And do you have the pain at the moment? No. Okay. When was the last time you had the pain?
About 3 hours ago.
Okay. When you go into the toilet, when you're doing a poo, I'm going to ask you some silly questions about poo now. Is that okay? When you're going to try and do a poo, is it hard to get the poo out? Do you have to strain a lot to get the poo out? Okay. If I show you pictures of poo on my phone, if that's okay, would you be able to tell me which ones you have? I know it's silly. What sort of poo do you get when you do a poo?
That one and that one.
Okay, so when it's this one tells us that you're a bit constipated, okay. Have you noticed any blood or anything when you wipe? Nothing on your tissue, nothing like that? No. Okay. What's her diet like?
She eats fine.
What sort of food would she eat?
Mainly containing bread.
Okay.
She likes paninis.
What about vegetables, fibre type thing? You're already saying no very much. No, okay. Because I think that's part of the reason. So normally when kids are constipated, usually diet has a big control. So we need to make sure we drink plenty of fluids, but also plenty of fibre, so vegetables and things. Can we have a feel of your tummy? Would that be okay? Perfect. So if you pop up on there, and if you lie back down for me, honey, is that okay? So all we're going to do is feel your tummy. Is that it? That's all we're going to do. No pain at the moment? No pain down there? Bit of pain there, okay. That's fine. If you pop back down there. I think we're going to give you something to help with opening your bowels. So this tummy pain might not be, but it's likely that it's all related to this constipation that you suffer from. What we give you to help with that, we give you some medicine. But actually, the main treatment for it is going to be looking at her diet, make sure you're having the good type of food. I know they don't taste nice. You know, I was horrible when I was a kid with vegetables, but like now I know the importance of it.
Thank you ever so much.
That's fine. Thank you.
Thank you.
Thank you. See you later.
Thank you.
Is that okay?
ever so much.
Thank you. See you later.
Still got 2.5 hours left.
Who was?
Me.
2.5?
Yeah, but well, you know what I mean.
2 hours and 20 minutes. Every minute counts. So it's 10 minutes knocked off of it.
Once you're in the hour, it's a breeze.
Oh, yeah, no, tell me about it. We've got a temporary registration patient coming, hopefully soon.
I feel like if I press these, I'll shoot out of this chair.
Are you nervous about going out or anything like that? Have you been out since then?
No, I was going to get bus time. I couldn't even get bus time. I ended up getting a taxi and...
Yeah, it's a very stressful situation to have been in. I think anyone would feel nervous about going out after something like that.
Talking about traumatic experiences is really helpful. Mental health and well-being is so important, especially in young men. It's just as important as your physical health. Evidence suggests that young men are most at risk of suicide. So if you are feeling troubled, down, anxious, please come and see your doctor. We're here to help.
So your legs and the difficulty with your legs, that's easy for me to take care of. It's how we manage the kind of the impact of being chased by these people.
It's paranoia, like there was someone who knocked at my door today and I wouldn't even go open the door.
Right, right.
Just because 2 months ago I ended up getting robbed at knife point.
Oh, God. Have you had any support kind of through these incidents that have happened to you?
I've done like therapy before. I've been on like all the antidepressants and stuff like that, which in my opinion I don't think they do anything, but...
They don't work for everyone, you're right. And if you've been through an awful situation or you're going through an awful situation, they can never take that away from you. I think there's more going on under the surface. We do have a fantastic counsellor here at the surgery, and she does talk to you back as well as listen. The first few appointments are about listening and getting to know you, but then after that, it's about talking about how to cope with things and how to manage things better. So why don't we arrange to see each other in a couple of weeks after today and make sure that side of things is settling, and if not, we can think about how we manage that.
Yeah.
Let's have a look at your legs. That's what you're really here for, isn't it? OK. So...
Give me a second.
No, take your time. Right, so if you just lie down on there for us. I'm just going to have a feel of your legs. Is that sore?
Yeah.
Yeah, they are very tight, aren't they, your legs? OK. What's happened to these muscles, really? It's just because they're not used to that distance of running, as most muscles aren't. They've become swollen and tender as a result. We need to give you something to reduce all this inflammation down. OK, I'll sort that out. Just come out when you're ready, Simon. I think there's a lot of positive things about you, Simon. I was just thinking about it. You're a young lad. You've been through a lot, you know. It's difficult things to talk about, but, you know, you've talked about them, and I think that's really important.
Yeah, it's hard to speak to my mum about stuff like that, and because she'll worry more than me. And
does she get worried as well?
Yeah.
As mums do, eh?
Yeah, and I don't want my mum getting more worried than I am.
Yeah, I think that's fair.
There's no point putting pressure on her, is there?
You're a nice lad, Simon. Oh, don't forget this. This is the key to your legs getting better.
Thank you.
All right, see you in a bit. Bye.
Wonderful, thank you.
I can keep hearing, like, you know, beep noises.
Not sure I can see anything.
It's there.
Right on the...
There, so it's there.
Sometimes in the middle of the night, it's like drum beats. I can hear this dum, 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 and then it stops.
Right, I'm Dr. Caris, and we've got Karen knocking around.
Yep.
So...
Sorry, what's your name?
Dr. Caris.
Carey.
Caris.
Kelly.
Caris.
Carey.
Toe your doctor mentioned. Toe your doctor mentioned.
Yeah, I'm not... No, sorry, yeah.
Sorry.
Come on through.
Thank you.
Have a seat, Mr. McGowan. So my name's Gemma. I'm a physician associate student working with Dr. James this morning.
Right.
Are you happy to speak with me first? And then we'll get Dr. James in. Is that OK?
Yeah, sounds, yeah.
Perfect. So how can we help you this morning?
Well, I've gone deaf in this year. Probably about 70% deaf.
OK.
I think I'm bunged up. You know, whatever the word is, congested.
Yeah, yeah.
That eye's not
The eye's watering as well.
Runny nose?
No, it's blocked.
Blocked nose as well?
Yes.
Are you happy for me to do a few examinations on you today? Is that all right?
Yes, love, yeah.
So I'm just going to start by taking your temperature. So just going in your ear. Go in the good one. Perfect.
Is it?
36.3, that's absolutely normal. I'm just going to go in the good ear first, if that's all right.
Yep.
And on the other side. Tell me if it's uncomfortable or painful.
No, it won't be,
Fine.
love, no. Won't be. No, it's not.
So when I summarise to the doctor, it's the ear that's concerning you most, isn't
well,
it?
even though it's me, and you know, like if I go like that,
Yeah. That's what it feels
I
like.
can hear that inside like a right loud noise.
I'll go and knock. I might be a few minutes if he's just seeing
Yeah, it's
someone,
all right.
but he'll come back in here with me.
I can nod off, can I?
Yeah, have a sleep if you want.
Right.
Right, thank you.
Okay.
69-year-old gentleman, Mr. McGowan. He's come in with 3-week history of gradual hearing loss in his left ear.
Okay.
It's sounding quite like a viral infection. He's got a bit of a stuffy nose, feeling a bit under the weather. Sorry for the wait.
Hi there.
Hello.
It's Dr.
All right.
James. Nice to see you.
All right.
So I understand that your hearing's been down a little bit.
This one, yeah.
Is it always in that one?
Yeah.
Sometimes if you're blocked up in your nose, there's a little tube that runs from your sinuses to your inner ear, and that little tube is blocked up.
Right.
And that pulls the eardrum a little bit down over the small bones of the ear.
Right.
And then that's probably what's caused your hearing to drop down.
Yeah, right.
And it'll probably stay dropped down until this clears.
Right.
So it might be 4 or 5 weeks.
All right.
Altogether. Can you breathe in and out?
No, this nose is... I can there.
It's really blocked,
Not
isn't
that
it?
one, yeah.
Have you broken your nose before?
No. Not that I know of.
It's quite inflamed and a bit angry on that side.
Right. In the past, when I've had it similar, I put my head over that albus oil in water.
That would help, definitely, what you just described. The other thing is a nasal spray, so I'll give you a prescription for that, and that should open it up.
Right, right.
Well, I'll go and do the prescription. I'll take Gemma with me, I'll go and sign it, and she can bring it back for you.
Okay.
Is that okay?
Yeah, thank you.
We'll see you in a second.
Yep.
That's fine. That's good. Yeah. I think hit the nail on the head there. A physician's associate is something that's been used in many different healthcare systems throughout the world to really good effect. They primarily support the clinical team, and that might involve seeing acutely ill patients on that day under the supervision of a doctor, helping triage or work out who needs to be seen most urgently, and also helping us manage some of our complex and chronically ill patients alongside the doctor. This is likely to become more normal in the future.
Right, here we go. Sorry for keeping you so long.
Okay, that's all right.
So this is the nasal spray. It probably will take about a week or so to start feeling the effects.
Okay, look.
And if after a few weeks you're still exactly the same, no better, do come back.
Right.
Is that all right then, sir?
Yes, love. Yes,
Thank you very much for speaking with me. Sorry we've taken so long
look. No,
today.
it's all right. Thank you.
Take care.
Bye. Bye.
Bye.
Number 17. You're both together, aren't you? Yeah. Can I just take a brief indication as to what the problems are today?
Mine is for a repeat prescription, and also I'd like to see the doctor about the pain I'm suffering, because I'm like it's a constant 24/7 pain.
And mine's for sick now.
So I can get you both seen together if you can either sit and wait until 10:20 or come back for that time.
Yeah, we'll come back at 10:20.
Yeah.
Can you wait on her?
I will.
Yeah. We'll live across the road 5 minutes. That sounds good. Similar like a sit and wait. And
Yeah, we did used to do sit and wait many years ago, but we decided to change because it was just too busy and not everybody was getting seen.
Well, where we used to live, they still do the sit and wait.
Yeah, you see, we're a very big practice, you see. We've got over 23,000 patients, so if we did that, you can imagine how busy it would get. Lovely. So that's both your appointments this morning. You both be seen together, OK? Yeah. Okay. All right, no problem, thank you.
Here we are.
Hi, come on in.
Sorry, they kept me up there.
Oh, I know, that's why We know there's a bit of a queue sometimes in the morning. So, it was this thing here, wasn't it? Would you mind if I just refresh myself? OK. Right. OK. So we've done a thank you for that. We've done a biopsy.
Yeah.
It's come back as a little bit thicker than we would have, than I initially thought.
Yes.
So the plan today is to remove that completely.
OK.
Just show you. From what we can see, if it's that sort of area, the current guidance is we're to measure 4 millimetres in all directions, and then we remove all of that to a cuff of healthy skin.
Yes.
OK?
Yes.
Right. Right, I'm going to draw on you now, OK, just so we can get the boundaries.
I have to say, it's better than going to the dentist, this.
Yeah, I agree. Right, OK, grand. Right, here we go.
Little sharp.
3, 2, 1. Skin cancers can appear in various different forms, and often in their very early stages can be hard to spot. Sometimes they can be just a small pink mark that doesn't settle or a scab that doesn't heal. In Barbara's case, she didn't have a scabbed area or a non-healing area, but it was clear to me once I'd looked at it down in a dermatoscope that it was cancerous and needed to be removed. If a patient is concerned, then they must go and seek medical advice and get checked over.
You're doing really well.
So at the moment, I'm just doing the deep layer. Would you like one of my tomatoes? Do you like tomatoes?
Yeah, I do.
They're really nice. I think they're really nice. Have a couple.
Small, isn't it?
Yeah.
So how do you practice doing stitches?
On an orange. On an orange, you make a cut in an orange
And then...
and then stitch it back together. Yeah, that's what I used to do.
So when I first saw those 3 little red, almost like pinpricks, how long would I have had this growing?
Well, it's a spectrum, really. It sort of starts off at some sun damage where the skin just doesn't heal particularly well. You get these little marks, and then you start to get little red or white marks, and then those can sometimes change into these things. Right, 5. What do you think, Karen? We're all right there, aren't we?
Well, I need the mirror now, you know, like we do at the dentist.
We haven't got a mirror, have we?
I'll see it when I take the dressing off.
Yeah, leave that. I'll just leave it like that.
Thank you for that.
No, you're most welcome. Any other questions?
No. I think
Right,
that's fine.
I'll leave you in peace to get yourself sorted.
Thank you.
You're most welcome.
Come and have a seat. I'm Becky, one of the nurse practitioners.
Hiya.
Hi, I think we've met before, haven't
Yeah.
we? Yeah. Hello there. What are we doing today?
It only happened yesterday. She was a bit chesty.
Yeah.
And then last night I was watching her breathing. She was struggling, you know, like breathing really badly.
Okay. And she went in hospital, didn't she, last year, did she, when she had bronchiolitis then?
Yeah.
Can.
She's got a high temperature, so I'll give her Calpol at 7:30.
Okay. Are you clapping? Are you clapping? Hey. And has she been coughing, runny nose
She's
or
had
anything?
a cold for about 2 weeks.
Okay. Right, sweetheart. Do you want to start getting her undressed and have a little look at you? Right, we'll listen to your heart, aren't we? Hey, I'm going to pop that there. And yours. What's that cough been like?
Barking.
More like a bit of croupy cough, really. So we're going to give her these tablets now, and then we're going to repeat it in 12 hours.
Right.
So do what you're doing. Paracetamol, ibuprofen, lots of fluids, wet nappies and things, OK?
Yeah. Right, that's fine.
Yeah. But we'll see what she's like this afternoon, and then we might just have to see her again tomorrow as well, just
Yeah,
to make
that's
sure.
fine. That's
Is that
totally
all
fine,
right?
yeah.
OK, I'll get door for you. All right, sweetheart.
Thank you ever so much.
See you later on.
See ya.
Bye-bye now.
Sylvia, please. Hiya, Sylvia.
Hi.
Come through. Come in, Sylvia. Please take a seat.
I'll have to take my coat off. I'm absolutely cooking.
My name's Dr. Eunice. I'm one of the GPs working here.
Yes.
How can I help?
But I cough and cough and cough. And then the sneezes come. It's uncontrollable. I can't stop it.
There's lots of different causes for cough. One of them is an infection.
Yeah.
Can we have a look? I think
Yeah,
that'd be
of
the
course
best
you
thing.
can.
So let's check your temperature first whilst you're seated. We'll check your temperature and your oxygen level. And then what we'll do is we'll have a listen to your chest.
Please.
You've got beautiful earrings on, or studs. 36.8 temperature, that's fine. This tells us how well you're breathing. So your oxygen level at the moment, 98%, which is very good. And your pulse is 67, which is perfect as well. So what we'll do is we'll pop you on there. Flip up the curtains round. We want to have a listen to your back and I want to have a listen to your front. And if you just take a deep breath in and out through your mouth for me, honey. Gonna tap on your chest. That's okay. Can I have a listen to your front as well?
You can.
Do you want to pop up behind the curtain for me, honey?
I'm just kind of coping because I lost my husband in end of May.
This year?
Yes.
Oh.
And he'd been in hospital before, you bring them out. And this time he went in and he didn't come out. So it was
Must have been
a
a
bit
shock.
traumatic. Yeah, it is a shock. He had internal bleeding and obviously heart failure at the end, of course.
It's horrible losing a loved one, isn't
is,
it?
yes.
And I think nothing can sort of replace that bond.
No.
How about you in terms of friends and stuff? Are you getting out?
Well, I do some voluntary work. I've done it for coming up to our 12th year. There's a church thing that has babies and mothers and carers come.
Good
they come for
like
an hour.
a huge community, isn't it?
Yes,
Yeah.
I worked as a nursery nurse all my life with children, small children. So I've been very fortunate.
In terms of your chest, when people are coughing and coughing for a long time, I want to make sure that we've had a recent chest X-ray just to make sure that
No, I haven't
that all
had one for a
sounds
while,
okay.
yes.
So I think let's get a chest X-ray
Yeah.
done. Listening to your chest, I can't hear signs of infection. No. And your oxygen level was 98%. You know,
good,
all of that
isn't
is very
it?
good. Yeah.
Yes.
But obviously,
Good.
if you do start bringing up the phlegm that you can see, or
Yeah.
things are getting worse, we want to see you again. But right now, touch wood,
That's lovely.
you're fine.
Oh, that's lovely.
And I hope it continues that way.
Yes.
Is that okay?
Oh, that's brilliant.
It's lovely meeting you. I'll pop this on. Do you need any help?
No, I'm fine, love. It's just I'm careful with this shoulder. It's a pleasure to meet you.
It's a pleasure to meet you.
Yes, and I'm very reassured with that.
You are a delight, Sylvia, honestly. Pleasure to see you. I'll leave an X-ray form out in reception for you.
Yes.
Out that way
Yes.
and down.
Thank you, dear.
She is lovely.
Take care.
Bye.
Thanks. Bye-bye.
Thank you very much for your help.
Cheers.
Take
You
care.
take care.
Bye.
Thanks. All the best.
Thank you.
All right, see you later. Bye-bye. All right, then. Thanks
All right,
a lot.
take
Bye.
care now. Bye-bye.
Good morning, Holford Health Centre. Sally speaking.
Stopping smoking is going to be one of the best ways of stopping your asthma being bad in the background.
Things I'm not ready to give up.
From one minute to the other, I start shaking. I feel like I'm going to collapse on the street.
You've got to live with this.
Yeah.
So we've got to find a way of keeping it under control, yeah?
You can get arthritic changes, but you're very young for that.
Tell him I'm young, because he keeps telling me I'm old.
What other drugs are you using at the moment?
Crack, heroin, bit of cannabis, and that's it, really.
I became a GP in the first place because I like the idea of being part of a community.
I loved it from the word go, and I still love it today.
There's never a dull moment, and you never know what's coming through your door, which is what makes it both interesting and challenging.
Patrick Smith. Yeah. Hi, Ben.
Hi.
Hiya. Come on in. Hi.
I've had a pain in my groin. It's been reoccurring over the last week or so.
OK.
And it's been gradually getting worse.
Yeah?
Finding it hard to go to the toilet. And when I have been, the pain increases.
Is it peeing or pooing that's been affected?
I think it could be both.
It can be both. So which is the worst one, then?
Peeing, I think.
Yeah, and when you say hard to go, what do you mean?
Stand there for a while, like, you know, thinking, I need to go, but it's not coming out.
And when you say your problem going for a poo, what's been happening with that?
Same sort of thing.
What do you mean?
Finding it hard to go.
In what way, then?
Well, I feel like I want to go, and basically not a lot really comes out.
Is there any pain in your bottom itself, or in the penis, or your balls, or...?
Well, it feels like it's around the front area.
And you're peeing normally when it does come out? And when your bowels do open, do they open normally?
Well, I waited the other day for about 6 or 7 hours until I really wanted to go, and I actually enjoyed that one. So.
What was that, for a pee?
Yeah.
So how can I help?
She's had a temperature over a week, so yesterday was her 3rd day she was sent home from nursery.
How high is the temperature going?
It goes up to about 39. She's had a persistent chesty, kind of almost croupy cough for about 2 weeks. In her nursery, there's a lot of chicken pox, so we don't know whether it's kind of the incubation period and we're just waiting for the spots to appear. I mean...
It's too long, in my opinion, that you don't get...
Well, that's the thing. Yeah, that's what we were thinking, so...
Yeah, OK. Let's have a look at her. Actually, I'm going to ask you to take her dress off, actually, just so I always want to be able to look at a chest. That's great. Yeah, what's this thing? What's this thing? That's sweet. Just a little listen there, just a little listen there. Good girl. OK. Let's pop this one in your ear, young lady. I'm sure you do it at home as well, anyway, don't you? That's OK now, no fever right now.
OK.
Oh, there's a bit of a cough, isn't there? Yeah. If you just... That's lovely. That's it, just so that I... OK, that's fine. Can I have a look in her throat?
Yeah, sure.
That's lovely. OK. Yeah, let's have a little look. Little one. Oh, you're poorly, aren't you? Okay, I know, little one. Let's have a little peek. OK, OK, that's it. Well done. It's all finished, all finished. Oh, little chick. You know, she's a little bit chesty, isn't she? We can hear the phlegm when she gives a cough. I think I should be giving her some antibiotics, but I also think I should be just getting the urine just to make sure we're not ignoring that. Okay. So I'm going to get you a pad thing to put on her to collect a urine sample. These kits have... This is like a little bag that you sort of stick over the bottom. So it's got a sticky bit that you put over her bottom, and then the bag will collect urine in. So what I need back is a pot with some urine in. Right, so you've got what you need now.
Yeah.
There's a prescription for some antibiotics. Oof. Little chick.
Uh-oh. She's like a little parrot. Thank you very much.
So, and if you were in the next 48 hours that she's not right, just bring her back sooner.
Yeah.
But I want us to review her definitely in 2 days.
That's great. Thank you very much. Appreciate that.
Bye
See you
then.
soon. Cheers. Bye.
All right, let's hop you up on the couch. Can I have a little...
I can't walk very far because the pain comes back.
Because of the pain. You haven't thought about trying any ibuprofen or paracetamol?
No, I didn't believe in that stuff.
No? I'm going to come and check your balls and your bottom as well, if that's all right. Let's have a little look at them. Is that where it's sore?
Oh, it's not comfortable.
Cough. And again. OK. Can I have a little look at your balls, then?
Yeah.
OK, that's no pain there. I know it's uncomfortable, if I... But that's OK. That's not bringing on the problem.
No, it's not comfortable, though.
I mean, it's often uncomfortable if somebody else is examining you, but whereabouts... Could just put one finger on where the worst pain is.
Where the worst pain is usually around about here.
Actually, in the groin, in the muscles here.
That's what it feels like anyway.
Do you want me to have a look at your bottom? Because it's a bit unusual about why you're feeling that it's difficult to go. Do you want me to check your bottom, or is it... Do you think...
I'm not very comfortable with that.
No? OK. Help yourself up, then. So, your examination's all OK. Yeah. And from that point of view, I'm a bit in the dark about why you suddenly got this pain in the groin. I'd like to check a urine sample and make sure that's all OK, so that's the first thing we'll do. I don't think that this would be linked to it, because usually this causes pain in the balls or pain when you pee or discharge, but you're not at risk of having a sexual infection, anything like that?
Oh, no, I haven't had none for a while.
I haven't had a partner for... When was the last time? Do you mind me asking? Was it...
About a year ago.
About a year ago. Would it be worth us screening for that and just making sure there's nothing going on there?
Yeah.
Yeah? So you're happy without any prescriptions today? We'll just get...
Yeah, I'm happy with that, yeah.
If you're sure you don't want anything?
No, I can cope with that. All right.
All right?
Yeah.
Cheers, then.
All right, thank you.
Take that to the front desk. They'll get you the pot and book you the follow-up.
OK.
Cheers, then.
Ta-da.
Hello.
So she said I should book an appointment with Dr. Boland.
Yes.
I have never, ever been to a doctor in this country.
Haven't you?
No. I am so lucky and such a lucky soul. I do not have any problem at all, to be very honest.
Thank you. Right, what can I do for you?
So basically, I'm not quite sure what's going on lately. It's been going on for a while, but I think I'm either anemic or diabetic. So I've been treated for PCOS.
Right, OK.
And I also treated for colitis ulcerative.
OK.
So the doctor I went and see with colitis said she pretty much think that I am anemic to go and get it checked.
OK.
But my life ever since then been a bit of a, well, I wouldn't say a roller coaster, but upside down, because I moved 3 times. I've got a new job, dizziness on a daily basis, that's normal.
Yeah.
Feeling sick just from, nothing.
Mm-hmm.
And what's even worse is I'm sleeping 12 hours a day, 14 hours a day, and I just feel even worse than before. Just so not myself. And basically, it just got to a point, it just can't go any further like this.
Are you ready to rock and roll, girls?
You're happy to swing that up and do all of that, and you're OK?
Yeah. Zen. And my thumb starts dancing on its own.
Did you get the pain straight away?
Because I'm a dancer, I get, like, weird things.
It's just making sure you don't do anything silly. Like
try not to.
dancing backwards or whatever.
Yeah.
How can I help today?
I had a pain in my leg the other day, and I found a lump there, and I was a bit concerned.
OK, well, let's have a look at this and see what's going on.
I do feel stupid now, but at the time it frightened me to death.
That's all right,
All right
worry.
with my shoes on?
Yes, come and have a lie down.
Right.
And roll up both your trouser legs, because I'll have a look at both sides.
Yeah, well, that's what I was doing, feeling both legs.
Good slim ankles, though, haven't you, there? OK.
At the moment, yes.
And where was this lump?
Right on the side.
Just this thing here?
No, down a bit farther. There, round about there. And it was quite large, and I couldn't feel anything on the other side.
It's just your bone.
No, it wasn't the bone.
No.
No, down farther. Round about there.
Round there?
Yeah.
So this is where your bone is.
Yeah.
If I go further down here, I can't feel anything abnormal. Do you want to sit up and show it to me? I might not be feeling in quite the right bit.
There.
I can't feel a lump, what I call a lump. We might mean different things.
Yeah, yeah.
I can feel your muscle there attaching into the bone, which is normal.
But I was getting pain from it on Monday.
Did it disturb your sleep or anything?
No, this was after I'd got up.
So you'd got up in the morning.
Yeah.
And you thought, oh, that hurts a bit, and you felt there, and you felt that was a bit different.
Yeah.
And then the pain eased off during the day?
Yeah, yeah.
And you haven't had it since?
No.
No.
But I was on holiday last week and I did a lot of walking.
It might just be a muscle thing.
I did wonder that after. Oh yeah, I dance. I like rock and roll.
Did you? Good. But I can't feel anything that's abnormal anatomy.
Oh, thank God for that.
If it hurts again,
Yeah.
or it worries you, then just come back into me.
Yeah.
All right?
Yeah, lovely.
So I won't
Yeah.
check your blood pressure this morning after that.
I'm going to a funeral now.
Oh, are you? OK. Hope that goes OK.
Okay.
Take care,
Thanks,
Jean.
Doctor.
Bye. Bye-bye.
From one minute to the other, I start shaking. I feel like I'm gonna collapse on the street. Other day, I went to do my food shopping. I was at the paying. I couldn't put my card in because my hands started shaking so much. I started to feel like I've got like red face, like a sweaty face.
And what's happening with your weight? Is that stable, going up, going down?
So it's all over the place. And my appetite just goes up and down as well.
Okay.
Which is obviously not a good thing.
And how's your mood?
Stress is something that's always been part of my life, but it's more from like childhood effect.
I don't think it's an issue now.
It's always an issue, but I
So
don't think
no
it has
more now.
anything
Right.
to do with what I just told you about the symptoms.
Can I just check your blood pressure?
Yeah, I've had to check it when I came in.
Oh, right. And was that today?
Yeah.
Let's have a look then. OK, so that's normal. Somebody who's fit and healthy, young, I'd say that's a normal blood pressure, OK. And do you smoke?
I don't, no.
No. Do you use any drugs at all?
No.
No? Drink much alcohol?
No.
So you are fit and healthy then?
Trying my best.
Let's have a little listen to your heart and your chest, if that's OK.
Yeah, sure.
This is cold, OK?
That's OK.
OK, that's fine. Have we checked a urine sample? Do you mind just doing that, just to check there's no sign of any sugar in there? Let me show you where the toilet is, and you can come straight back in, OK?
Oh, I'll tell you what I got the other day. Marks and Spencer's, half price, on chocolate truffles. They're so nice. I got some for my sister. Did you? Yeah. Well, I had got some for myself. They don't last long.
Yeah, I was going to say, once they're open, that's it.
That's it. Literally.
This is one heavy door?
Yes, it is. OK, thank you.
Thank you.
OK, so that's reassuring. There's no sign of any sugar, any white cells, any sign of infection or any blood. OK, so what I'd suggest then is we book you an appointment for some routine blood tests.
OK.
And then a follow-up to see your doctor, and then she'll look at the results and follow on from there.
What do you think from what I told you so far, what it could be?
It's not clear at the moment. I mean, the way you describe the way you feel you need to eat, I mean, that can be lots of different things. I mean, sometimes people can feel faint for different reasons. I don't think it sounds like anything serious to me. OK, so if you go to the reception, book a blood test, and then book a follow-up appointment with Dr. Edge.
Right,
OK?
All right, thank you very much.
All right, no problem. Bye-bye.
Bye-bye.
Ben Rees, please. Hello, Ben. I'm Dr. Edge, and we're at the end of the corridor. OK, do you want to just follow me? Come and have a seat. It says here that you've come to see me about your eczema.
Yeah.
Yeah.
As you can see, it's like quite dry and quite bad. And like my neck is quite dry.
Yep.
And it just doesn't seem to want to go away.
OK. Do you have anything to put on it at the moment?
No, I've run out of Cetraban like a couple of days ago.
OK. Oh, is that all you had, Cetraban?
And I had some steroid cream, but I haven't used that on it.
You haven't? OK. Let me have a little look at what's affected here. OK, so it's on your arms.
Yeah.
And they feel really dry. And your skin's all sort of thick from the eczema as well.
And like, if I'm like in a hot room
Yeah.
and I go out into like, the cold, my skin does sting a lot.
Can I just have a look at your legs? Do you mind?
It's like all the way up here.
And on the back here, yeah. Ooh, yeah. And can I see your back?
It's pretty much all over.
Have you had it as bad as this before?
Yeah, like it can flare up, and then sometimes it doesn't.
Yes. Okay. So actually, it was me that saw you last year, almost the same time last year.
Must just be winter.
It may be. Do you think you'd recognise that from previous years?
Yeah.
The dry cold is not good for eczema. It's very dry, your skin, so you need quite a potent and oily moisturiser, and just see if we can get your skin looking a little bit better. And the itching's bad.
Yeah.
I'll give you something to take at night to help with itch. I want to give you 2 different types of creams, so I want you to have something for your body and something for your face. We need to treat your face differently. Does your face bother you?
Some days it'll be like almost like normal, and then some days it'll be like dry around my eyes like it is today.
Yeah.
And then, it just varies from day to day.
Yeah, that's rubbish, isn't it? OK, so I'm going to get you to come back and see me in a couple of weeks' time so that I can have a look and see how you're getting on with this. And then we'll think again about whether we refer you on, all right? Because you've got to live with this. It's not going to disappear.
Yeah.
So we've got to find a way of keeping it under control. Yeah? OK. All right.
OK, thank you.
All right, then. See you in 2 weeks' time.
At the moment, the biggest pressure facing general practice is that the demand is outstripping the capacity.
We've got an ageing population with complex medical needs.
I think there is a big change coming in general practice.
Technology will play a big role in that, whether that's increasing remote consulting with patients or whether it involves the use of artificial intelligence.
Small individual practices of 2 or 3 GPs who know their patients very well will be lost, and we are increasingly already joining into large conglomerates.
But there will always be a need for general practice, and that need will increase as we try to take the pressure off the hospital sector.
Zabby, please. Hi there. Have a seat. Hi. It's your mum and dad?
Mum and dad?
Mum and dad. Stepdad. Right. OK, what can I do for Zabby?
OK. He's been complaining of a headache.
Yep.
We did have a car accident. The headache come on after that. So that's been over a month now. For 2 weeks, he's been coughing really, really badly during the day at night time. Been giving him his asthma inhalers, the brown and blue. Doesn't seem to be working. Yesterday, he started complaining of heart problems.
What do you mean, a heart problem?
A bad pain in his heart, he said. It kept on stopping and going.
Then the top of my spine was hurting.
You're in the wars a bit, aren't you? So, just in terms of the headaches, what are the headaches like?
They're like medium, not like...
So where on the head are they?
Just there.
OK. And when do they come on?
It's been like every other day, probably.
OK. How bad was the car accident?
It gave us all a good jolt.
Yeah.
Okay.
Like, we were going this way and it literally just hit near the back
And
wheel.
when did he last see the optician?
He hasn't, actually.
Okay.
No, at school he got checked, yeah.
OK. So anybody with a new headache, I would suggest see an optician. They have a look at the vision, but also a very good look at the back of the eyes to see if there's any underlying cause to the headaches. I think that's something that we need to do.
Okay.
So you need to arrange that, OK? Any nausea or vomiting?
You were sick yesterday, weren't you, in the shower?
Yeah, it's a big lump of it.
Ooh, lovely.
You swallowed it?
Yeah, by accident.
Can I pop this on your finger? Looks at your oxygen levels. What do you think they are, without looking? Without looking, that's cheating! OK, 98%, that's pretty good. Oh, right, can I have a little listen to your chest? If you take your jacket off. OK, and can we pull this up at the back? OK, some deep breaths. Good, and again. OK, right, have you blown into a special tube before?
Yeah, he's got one of these.
Yeah, so you know how to do. So what's the best you've ever got?
250.
Fantastic. What can you get today, do you reckon?
700.
Brilliant. OK. I like you to be optimistic. Deep breath in, blow as hard as you can.
Oh, not good.
Oh, it was a good effort, though. So, examining him, everything seems absolutely fine, OK? And from what you've told me, There's nothing that's particularly worrying me. I think he's picked up a viral infection that is just making his asthma a bit worse. However, let's see how he goes. Is that all right?
Yeah, that's what I'm dreading. When it comes to winter with him, I'm literally always on edge because when he was 2, he had a febrile convulsion.
Okay,
I'm really very, very panicky. I can't sleep, especially when he's coughing at night time.
Babies and toddlers can't manage temperature control very well.
Okay.
At the age he is, it would be really rare to have a febrile convulsion. Okay.
Yeah, now listen, please.
It was scary.
I bet it was, and you remember that.
Yeah. I was going to keep him off of school tomorrow.
Back to school tomorrow, I agree. I agree. OK, oh, very trendy. OK, bye-bye.
So how can I help?
Everything's up in the air.
In what way?
It took for a few days. So I've missed my medication, I had this, everything's just gone up in the air. I feel like self-harming, you know what I mean? I'm starting to cut myself again. I'm paranoid all the time.
It's a difficult patch for you at the moment from the sound of things.
Pretty much. I got released yesterday from Guy's Marsh prison.
Okay.
Last time I got out of jail,
Yeah.
I ended up getting back on it. So this time I put a few things in place to make sure everything was right.
And have you used at all since you've been out?
I used nothing.
What's that from?
Burns.
With cigarette butts, or...?
Yeah.
So in prison, you were essentially bullied? Yeah?
Pretty much. I need to obviously get back onto my medication.
Yeah.
I need to obviously get back in contact with my job worker and explain, because obviously I missed an appointment with him.
So have you got money?
What do you mean money?
Are you getting any benefits?
Due to get paid Friday. But
Okay.
they already tied me over last fortnight because the sick note ran out.
I think the doctor who was asked to do that felt we couldn't do that because we hadn't seen you.
Oh, right.
So I think that we needed to be able to see you before we could issue a longer sick note. Where are you living at the moment?
Staying there.
I've had an earache now for 4 days, and it was so bad that I was in tears.
Did they say why you were deaf?
A few years ago, I fell downstairs, fractured my skull.
Went to sleep about 4 o'clock, got woken up about 6. With severe pain, feeling like it's just being stabbed.
Is it painful if I touch here?
It's painful.
Yeah.
You can just touch it if you need to.
My ear just started hurting. No, it stopped.
Could you hear what she said? She said yes. She said, I can hear what she said. I said, do you know what she said? She said, no.
Hi, you want to come take a seat? I thought we'd met before, but I don't know if have we met? I thought I recognised your name.
I don't think I've met you.
Right,
but...
hello, hi.
I came to see Dr. Thomas, I think, last about my ears.
Dr. Graham.
Oh,
Yeah.
Graham?
Yeah.
No, you're Dr.
Yes. Don't worry.
Thank you. And she gave me some ear calm. Hasn't really worked, and my left ear is now in a lot of pain and woke me up last night with the pain. The pain that I've got now I've had for the past 3 days. It's really sore.
I mean, have you had trouble with your ears before, Zoe, or not?
Not since we moved to Bristol.
Right.
In London, I had some problems with my ears, and I had some really great antibiotics. That was a spray or a drops.
Otomide,
and
probably.
it just,
You're pregnant, aren't you?
Yeah, and I'm
Just
pregnant.
need to double check that,
So
make
I need
sure.
to make sure that nothing clashes.
Yeah. Right, let me have just a little check of your glands under here, if I may. So, you know, pain from the ear can come from different places. It can be from the canal itself, and it can also be from the drum. If you've got an upper respiratory tract infection or a cold or sort of upper viral thing, then that can be associated with eardrum trouble. The other problem with the canals just tends to come on its own with nothing else in particular, but can tend to be a recurrent thing. So it sounds to me like perhaps that's what you've had a bit more of. Anyway, let's have a look and see. So this was the one that was the problem when you saw Dr. Graham?
This one is better now than this one, but it still seems crusty to me.
If I pull on your ear like that, does that hurt?
No.
If I press on here?
A little bit, yeah.
OK. Does it hurt when I'm looking in there and moving that around like that?
Only a little bit right down the bottom, but not too much.
OK.
Like down here.
The drum looks fine. The only observation with the drum is that it's a bit dull, which would go along being a bit congested. It's not red or inflamed or infected. Let's have a look on this one. Same again. If I just pull on your...
Yeah, this
on
one's,
your drum in your ear.
one's more painful.
Sorry.
No, it's OK.
Here?
Yeah, it's painful right there.
A little peek inside as well. OK, that looks quite angry, and it's the canal that's angry. And again, the drum looks OK, apart from... Oh, sorry, leave your little friend in there. So I think you've got otitis externa, which is an infection in the canal. The right canal looks just a bit dry and eczema-y. The left canal is red. And it's the left one that's giving you pain, isn't it? Now, let me just see. How many weeks pregnant are you?
20.
How many have you got? Is this first, or have you got any other ones?
It's my first. Oh, we're recurrent miscarriage, unfortunately. So this is my 7th pregnancy.
Were your miscarriages early, or what sort of
they were all in the first trimester.
Okay, so
and we're under consultant care.
And so 20 weeks were brilliant, fantastic. So I mean, it's not like I want to give anything wrong in pregnancy, but I really definitely quadruply don't. That sounds awful. Like I don't give a monkey's about the other pregnant patients. So big red, not recommended in pregnancy.
Oh, well, can't use that.
I'm going to speak to one of the chemists and give you a call back later.
Okay.
So I'm not going to give the Sofradex until I've got this sorted. Is that okay? I don't mean to waste your time, but I would rather get this right, really. Okay. I'll give you a shout shortly.
Thank you very much.
Thanks, Zoe. Thank you. Bye.
What's going on your face here?
I've got it all over my body.
Right.
I've got it all over my body. They can't seem to get rid of it, so... I had him just before I got out of prison because of stress and worrying. Obviously, life going back to the way it is, and then me going off key and just everything else just getting on top of me and just can't cope.
And let me just see your hands and just turn them over that way for me. Just wondering whether you've got scabies or something like that that's making you so itchy. Have you had this sort of thing before?
Yeah, I get it all the time when I've been mixing with drugs and that, and it's just everything, my depression and just... Everything.
Right. I can give you some antibiotics, which will take the infection away. Yes, yeah, I can see.
I started from shaving and that's...
Right, OK, well, you've got to leave it alone, haven't you?
Yeah, it's really hard.
Are you able to wash?
You can wash.
Do you have access to be able to wash?
Yeah.
Yes?
Not all the time, but yeah.
Yeah. I think we've just got to try some antibiotics in the first instance and see if we can get your skin a bit better. Does it feel itchy?
Yeah, sometimes.
Sometimes. I don't want to give you more medication, really, but I was thinking if it is itchy, we could give you something for itch.
It's something from a paranoia, that'd be good.
Is that a new thing, or is that something you've had before?
I've had it before, but I've managed to get rid of it. It comes and goes, and sometimes bad.
Is it to do with other medication that you're using?
Drugs, I suppose, and the life I've been through, pretty much.
What other drugs are you using at the moment?
I use crack, heroin, bit of cannabis, and that's it, really.
I think at the moment I want you to get back onto what you were meant to be taking regularly. And once we've seen your urine and we've got you back on your buprenorphine, the Subutex, we can just decide whether or not we do anything else and try and get your skin a bit more settled. OK, so I'll come to the desk with you to ask them to print you off your thing for your next appointment.
Really fed up with all of it.
We'll just have to chip away, yeah?
When a patient comes into the surgery, I'd suggest they really think about what they want to gain from that appointment.
Be aware that we only have 10 minutes allocated per patient and have maybe one problem to deal with at a time, dealing with the most important first.
The one bit of advice I'd give to patients is to never give up. Certainly, having been a GP in the same practice for over 20 years, I am amazed at the number of patients who I thought would never manage to change, do so, and their lives are radically improved.
So what's been happening then?
I woke up this yesterday and I woke up today and it's got worse.
OK.
But I'm prone to chest infections and I've got asthma as well.
Yeah.
Don't help I smoke, I know. Last time I had a chest infection and I didn't take that much notice of it because of my asthma.
Right.
And ended up with pleurisy. So I'm struggling to talk and breathe and I'm like all the time.
So you've lost your voice. What else has been going on?
Chesty.
Yeah, bring up phlegm.
Phlegm every morning, but some of that is probably still my asthma. But when it goes green, that's when I...
How long has it been green for? Go on, tell me.
A long time.
Go on, give me a...
Like 2-3 weeks.
Oh, it's been bad for a couple of weeks?
Yeah.
Do you think your asthma has been the cause of this, or is it sore throat? Or?
It's not sore. I just lost my voice, and I'm just like...
So your asthma has flared up?
Yeah.
But you've not felt...
No, I don't feel generally ill
No,
at all.
and you've been to work today?
Yeah, I went to... They was one that told me to come to the doctors.
You haven't been coughing up any blood, or...?
2 days ago, I coughed, but it was, like, in with the phlegm, so I didn't know if it was, like, where I've retched from coughing and it's come up like that.
Well, that is actually quite a common thing to happen if you've got a chest infection. As long as it doesn't stay like that, and it's only just a one-off when you've got a chest infection and the asthma's been flared up.
Yeah, because I've got steroid inhalers as well.
Do you been using that then?
Yes, I have, but I can't get them until Friday.
Can't get what?
My prescription until Friday because I got been paid till Friday.
Oh, I see. Because your oxygen level's OK and your pulse is a bit up.
Oh, is it?
It just probably shows that you've got this infection that's going on. How many are you smoking a day?
I haven't been smoking much because I smoke roll-ups and I can't bother to make them.
OK, well, that's a good sign. Because obviously, stopping smoking is going to be one of the best ways of stopping your asthma being bad in the background.
Thanks, I'm not ready to give up, really.
Why is that? What do you think would need to change for you?
I don't know. I just enjoy it. It's
Sure.
a really bad thing, really, isn't
Well,
it?
I mean,
Enjoy it.
naturally, I'm going to say you should give up, aren't
I know,
and I can
know
only
I
encourage you
should,
to do that. But
I have tried to give up.
Well, if you want some more support when you're ready to do that, we're here to help you with that. Stand up and give me a good one of those.
OK.
OK. 350. With your asthma, in general, before it all got worse a few weeks ago, were you getting symptoms every day, or were you getting...
Yeah, every day.
So you have had that for a long time?
Yeah,
Like months?
That's months, years.
Is it stopping you doing anything?
I struggle to walk, because I'm a walker in work, so I walk to people's houses.
Oh, I see.
I have to go down the hill, and then I got to go up the hill. So it's like puffing away on
So it
that.
is stopping you doing things because...
Yeah, a little bit.
In general, or just...
Yeah,
just
really
when
in
it's
general,
bad?
because I walk every day and work.
Let's have a listen in. Just stand up for me. Can I lift this up?
Yeah, of course you can.
Can I go under here?
Yeah.
Sorry, cold hands. Deep breaths. OK, have a seat. So you've got loads of wheeze and a few crackles on the right-hand side. Okay. So I'm going to give you some antibiotics and some steroids.
OK.
Let's have a look in your throat. Oh, it's all quite red there. I think probably that's all to do with the coughing, although there may be some infection as well.
Yeah.
Sometimes you can get viral infection that triggers off the asthma, and sometimes it's bacterial. But I think because of the green phlegm and the breathlessness, we'll give you some antibiotics to cover it as well.
Thank you.
And let's get you back on the steroid, and then come and see us in about 6 weeks' time.
OK.
But if it's really terrible, then come and see us again sooner, obviously.
OK, thank you. Oh, you're a good doctor.
Well, I try my best.
Thank you very much,
All right.
doctor.
Nice to see you. Cheers, then.
Bye.
Bye.
Right, what can I do for you?
I saw Dr. Graham a couple of weeks ago because I was getting pains in my arm and in my fingers here. And she gave me some amitriptyline to take to try and help with the nerve pain.
Do you think that's changed at all, any of that?
It's not as intense, but I'm still getting a bit of pins and needles and a slight bit of pain here, but it's mainly focused around the thumb.
Let's just have a look and see if there's any wasting. So I just wonder if that's a bit less full than that. Do you see what I mean?
Mm-hmm.
If you're getting pain in it, you can get arthritic changes and then the joint will change shape, but you're very young for that, so I think it's unlikely.
Thanks. I take that. You tell him I'm young because he keeps telling me I'm old.
These things are all relative. To me, incredibly young.
Thank you.
That's all right. That loss of the muscle there makes me think that actually there is a bit of nerve being affected. Now, I'm just going to hold your wrist down. Sorry. Oh, does that hurt, just doing that? So what I'm doing here is just to see if this makes the pain or the symptoms in the hand come on.
Pins and needles are getting more intense.
They're getting more intense.
Mm-hmm.
So your neck is staying completely still as we're doing this, but that's squeezing the nerve here, the median nerve that comes into the hand. So that makes me think it's more likely to be carpal tunnel.
Yeah.
When you do that, as we did, it makes it worse. So some people find that if they buy a splint that holds their wrist a bit like that, it stops that happening in the night, and therefore that's a bit more comfortable. You could do nothing and see if it settles itself, or if you would like, a steroid injection into the wrist just reduces the inflammation there and often sorts the problem. Dr. Graham does a lovely steroid injection.
You just palmer on someone else. Is that because then I'm not blaming you?
Yeah. No, actually, you want
else.
someone who does quite a lot of them. So rather than us all do it once a year, 2 or 3 people do quite a few of them, and actually she's very good. If that doesn't work, occasionally people have an operation and they just release the nerve here, and that sorts it out. Well, why don't we go for that, actually, because I don't want that getting worse.
Yeah.
So go to the front desk and book a steroid injection.
Would I still need a splint, or...?
The splint is just for comfort, really. Let's just go up.
And I think I've trapped a nerve here.
Did you get married recently?
I did.
Oh, congratulations. Where did you get married?
We got married in Weston, a church in Weston.
Lovely.
The reception at a place called Yarlington Barn.
It's great. How lovely.
Socks are the bane of my life. Seriously, I've got an odd sock thing at home with all of Adam. I don't know. I don't know where they go. It's just, honestly, all the odd socks go in a big basket. And every now and again, I go through trying to find a pair. And if I've had 3 or 10, I think I've wasted 2 hours looking for socks to go together. That's a lot of time.
What, 2 men in the house?
Yeah, I know.
So what? The sizes are different?
I don't know. Fins are easy to find because they're little, obviously, but it drives me mad.
It's your socks.
Yeah, sort it yourself. Yeah, I know. That's it.
Lloyd Petson, please.
Hello there.
You've got doctor as well. Are you medical or...?
No, I'm not medical.
PhD?
No, I'm PhD,
Yeah.
yes.
What PhD is that?
Theology.
Oh, interesting. Right,
So
how
you've
are
got-
things?
OK. As you can see, I've been discharged from cardiology.
Which is good.
Which is good, but I still don't know quite what's going on. I thought I'd just have a check-up just to see how the meds are going and so on and so forth. I also had a strange turn on Saturday when I just didn't feel myself. Took my blood pressure, it was about 180 over 98, heart rate 34.
I am concerned about her sleeping because she snores like nobody's business.
I can't sleep because every time I fall asleep, I get pins and needles in my eyes.
In 1 week, I sleep for 26 hours, which is 2 or more hours in a whole day.
That's enough sleep for you?
No, not really.
My eyes have gone a bit funny today, but I think it's just pure tiredness.
Is it upsetting your sleep? It's disturbing your sleep?
It's too painful to sleep. I'm walking around the room nearly all night.
I sleep and all the air stop. I wake up, I see no air, I move, and my heart is going.
Hi there, do come in and see. I'm Dr. Cordell. It's your first time here, I think?
Yes, it is, yeah, it
Have
is.
you just moved or moved practice?
I haven't moved practice, no. I've been quite bad with keeping on top of being assigned to a doctor's.
How long have you been in Bristol?
2 years.
2 years, OK. Yeah. What do you do?
I was an engineer and now doing a PhD.
OK. Was it in an engineering topic?
In neuroscience, actually, so I've kind of changed.
Fantastic. What do we need to discuss today?
So it's been a long-term issue, but especially recently I've been suffering from insomnia. Generally, getting to sleep isn't the problem. It's just I wake up very early and then can't go back to sleep. It's not like Fight Club levels of like not sleeping at all. It's normally just long-term. I don't think I've got more than 6 hours sleep in probably more than a month, I'd say. So it's just like a slow build-up of getting more and more tired. It's sort of getting to the point where if I could have some sort of sleeping pill and I could take it occasionally when it's getting bad.
What time do you stop looking at screens?
It's generally quite late, It'll probably be until about 10 minutes before I go to bed. I will be probably.
Okay. Coffee? Tea?
Yeah, I don't drink caffeine at all.
Could you just ask about alcohol? What would you drink in a typical week?
Yeah, really not very much at all.
No. We also want to make sure that people aren't depressed because that's a common cause of poor sleep. I mean, how would you assess your mood on a general basis?
I'd say I'm generally a very positive person. I think it's difficult to see which is causing what.
Yeah, sure.
But definitely my mood hasn't been as good recently.
So are there things you enjoy in life at the moment? Getting pleasure from your studies, from your work?
Yeah. Honestly, I just think too much. If I wake up and then I'll just start thinking about something. And recently, because of this trouble to sleep, I start thinking about the fact that I'm not going to be able to sleep. And
yes. And then it goes round, yes. So, I mean, your request was, could you have something just to take now and again if it's desperate? We could do that. It's not something we like doing because our experience of taking medication is that one pill tends to lead to another. It's sometimes worth trying one of the sedating antidepressant tablets. Now, I don't think you're depressed, but the sedative antidepressant tablets are not addictive in the way that something like Zopiclone or Diazepam is addictive. So I think that would be my preference to do that if we're going to prescribe anything.
Cool, thanks very much.
OK, cheers. All the best with the studies.
Thanks very much.
What I've got to do is got to take it off.
You have to take it off and, remove the foil. Yeah. Every time I try to pull it off, it kind of slide off. See? Hit brute force. Try to make a hole. There it is. You're all right there.
One of the things I wondered is when I went to see the cardiologist last time, they were saying the beta blocker has a short half-life, so that they recommend taking it twice a day. But my heart rate is so slow.
Yeah.
He was quite happy for me to just take.
I think that sounds reasonable.
Is there a half dose of that? Is there 12? I think I'm on 25, aren't I?
Yes. So you're on 25.
Right. Is there a 12 and a half?
Yeah, there is.
Yeah. If we could change it to that, then I can take that twice a day.
Yeah.
At the moment, I'm just breaking them in half. It's probably time for the annual blood test, then, isn't it?
It probably is, isn't it? We could check it again then.
Okay.
We'll check your cholesterol, thyroid, blood count. The thing I don't think I've done is vitamin D.
No, I don't recall a vitamin D.
We could check it. I'm not a believer.
Yes.
But some of the doctors say, you know, if people have vague aches and pains and tiredness and they find it's low and replace it, they've had experience of people feeling a lot better.
Okay.
I'm yet to see that, but...
Yeah, OK, well, why not? Why not?
If I get one person that comes back and says, I've been treated with it and I feel so much better, I'll be converted.
Great sample size.
Yes, yes. Really good medicine. What are we going to do about the statin?
I'll take it.
OK.
It's insurance, isn't it?
Yeah.
When I went to see the cardiologist last time, he was quite insistent I should be on it, but...
Yes, in an ideal world you should be on it, but it's if you can tolerate it.
Yeah.
And so it's weighing that up, isn't it?
Yes. I'm living with it at the moment, so I'll carry on at the moment. If it gets silly, I'll obviously come back.
Yeah, good. How are the wedding plans going?
Excellent.
Are they?
Yeah, I'm a chief wedding planner.
Yes, Kezzy said that. She said she couldn't do it, so
No, so I'm done. Yes.
Is it going to be big?
No, it's at Walton Castle.
Right.
So it only holds 50 for a wedding breakfast. It'll be about
That's
50. Yes, nice. She wanted a small wedding. Then we'll have about 100 in the evening.
Right.
So.
Cool.
Okay.
Well, nice to see you.
Fine.
Okay.
Lovely, thank you.
Lovely
Nice to see you.
Yes.
Take care. Thanks a lot.
Yeah, see you
Bye-bye.
soon. Bye-bye.
Bye-bye.
I still enjoy being a GP. I enjoy the relationship with my patients and I enjoy the relationship with all the team at Horfield. Let me just do the door because it's really heavy.
See you soon. Well, not too soon. One bit of advice I'd give to medical students is that it is great being a GP. It's always variable and you work with great colleagues and great patients.
It's also extremely fulfilling. I think it's a great career.
Bye. Have a lovely holiday.
Thank you.
Bye.
Bye.
Thank you.
As I'm going to retire in the next couple of years, I'd like to see general practice continuing to be a strong and reliable service available to me as I get older and to my family.
My dad had high blood pressure, he had a stroke, my mum had a stroke, my sister's diabetic, she has heart problems. So it's in the family.
It's in the family.
Yeah.
She has noticed a painful lump. I think she needs to be seen.
That is the most uncomfortablest thing I've probably ever had, but I don't care how.
I am so sorry.
When you're younger, you hit yourself and you go, and of course, but I'm getting older, so I'm forgetting things, but I don't remember banging it.
The main artery was over 70% furred up. They said she was a major stroke waiting to happen.
I thought, oh Christ, when you're bleeding from the ear, you know, you should think to yourself, you know.
The end is nigh, yeah.
Near, yeah.
Spinal Road Surgery, how can I help? 9:10 it was, she's missed it. We don't have 10:09 appointments, it was 9:10. So you need to phone back at 12:30 for an afternoon appointment. OK then, bye-bye.
Lauren Manning? Dr. Hyder, come through and have a seat. How can I help you today?
For about a year, it was not long after I had him, waking up in the morning and not being able to move my hands.
Oh, OK.
When he was really little, I'd wake up in the middle of the night and I couldn't even unscrew a bottle to make his milk. And then it calmed down, and then I just found out that I'm pregnant again. And the first sort of 4 weeks, they were terrible, to the point where in the morning I couldn't even get them dressed. Right. I spoke to my mum about it, and she's had carpal tunnel. And she said to me, it sounds similar.
Do you feel tingling?
Yeah, you know, before you get pins and needles, you get that dead arm sensation. It's just like that. You can't do anything
And it's
with
both
it.
hands?
Both hands.
Any visual problems?
Sometimes things go a bit blurry. I don't know if that's just from having two kids and just not having enough sleep.
OK, so how often does that happen?
I don't know. I don't even take much notice. I'll just be driving and think, oh, God, my eye's gone a bit funny. Steady.
And is that one eye or both, do you think?
Probably my left, I would say.
OK, so is it all right if I examine you? I want to examine the nerves that supply your head and neck, and then your arms as well.
Yeah.
OK.
Can you not?
So I believe you've been referred to have your knee looked at by the orthopaedic people, and
I have, yes.
And have you seen them yet or not?
No, I've got an appointment at Heatherwood Hospital on the 28th.
OK, right, good. OK, so that's underway.
Yes.
And this is with a query as to whether they'll go ahead and replace the whole knee. OK.
Yeah.
So the question is, can I help you in the interim by injecting into the knee to see whether it calms it down a little bit for you? And the answer is yes, I can. Are you happy for me to go ahead?
Yes.
OK, mate, I'll get this injection ready. A couple of things about it. Firstly, it's a steroid. It may flare it up for a few days, OK, before it starts to work.
Well, I've had it before.
OK, so you know
So I know what happens, yeah.
OK.
So the last time I had it in the hospital, suddenly started to feel frightened to death because someone went in before me and there was a massive scream. And all of a sudden, there was doctors and nurses flying from everywhere.
No.
It stopped breathing.
No.
Yeah. And I thought, I've got to go and have that now.
Well, I'm going to try and avoid that today. Come and have a lie up here for me.
OK.
If we can get you up here.
Yeah. I struggle sometimes to get into the bath.
There was a thing on the news a few weeks ago. There was that dear old lady. She took a bath and couldn't get out. She was in there for 4 days. And she survived. But the reason she survived is because on every Wednesday she used to go down to the same cafe. And when she didn't turn up, they got really worried about her. So they went round to a house and heard her calling and got the police and pulled the door down. It's a lovely story. But,
yeah, that could be me, you know.
What do you reckon? Make sure you start going to some place all the time with some nice stuff. I need you to try and relax that as much as you can so it's as floppy, really. You're doing well. Still with me?
Yes, I'm still with you.
Right, it may hurt for a few days.
Okay.
Hopefully after that it will just sort of ease off.
Yeah,
Nice to
you're
see
very
you.
lucky. Yeah, nice to see you. Thank you for
I hope
that.
the operation comes along as soon as possible.
Yes, so do I.
OK, mate.
Well, I'm looking forward to it, I'm afraid.
See you later. Bye-bye.
Thank you.
Follow my finger with your eyes. Are you getting any blurred or double vision?
Yeah, a little bit.
Where did you get it?
There.
OK. And can you feel me touching you?
Yeah.
Is it about the same on both sides?
Yeah.
Screw your eyes up tight and stop me from opening them. OK, that's fine. Do you wear glasses at all?
No. I had my eyes tested since I was about 14.
OK, well, it'd be worth doing that as well, wouldn't it? Yeah, with all of the symptoms going on.
When you've got kids, you just forget about yourself, don't you?
Yes, you do.
They're more important.
So if you can keep your head still and just focus up here.
Yeah.
Try not to look directly at the light. OK, that's fine. I'm wondering what's going on. And then if I can check your arms as well. So if you can just roll your sleeves all the way up for me. You're being very good.
Oh, that's my toe then.
So can you feel me touching you?
Yeah.
About the same on both sides? You squeeze my fingers? Yeah. Put your arms up like this and stop me from pushing them down. Put your arms in front, push me away. OK, spread your fingers apart like that, stop me from closing them in. OK, that's fine.
So with carpal tunnel syndrome, it's very common
Yeah.
and it becomes worse in pregnancy.
Yeah.
So it could well be that. The thing that's a bit unusual though is, and you've also got some eye symptoms too.
Yeah.
So I think it's worth referring you to see the neurology doctor, so the specialist.
Yeah.
And the thing we want to make sure this isn't is something like MS, so multiple sclerosis. Have you heard of that?
Yeah, I work in care, so
Okay,
I look after
yeah.
people with all sorts of
Yeah.
random things.
And is there any family history yourself of MS?
No, nothing in my family, no.
MS is an autoimmune condition, which is when the body's immune system can attack its own cells. In the case of MS, the immune system starts to attack the nervous system, and in particular, the myelin sheaths, which is a fatty substance that protects nerves. Women are twice as likely to develop it than men. It is also more prevalent in people with a family history and people aged between 20 and 40 years. So that's a referral to make sure it isn't something like that.
Yeah.
And if they think it isn't, then we can look more at the treatment for carpal tunnel syndrome.
Yeah.
And I'll give you a leaflet on carpal tunnel as
Yeah.
well.
Yay!
What a good boy you were. Well done.
Bless him.
OK, take care then.
Thank you.
Hello. Hi, yeah, come and have a seat. How are you?
I'm not very well.
What's been happening?
Maybe you remember.
Yeah, and I saw you, and then you came back, you saw Dr. Ward, and then he gave you some more antibiotics, you had an X-ray.
Yes, first of all, I was coughing, only dry cough.
Yeah.
And then started to come out mucus.
Like
And
brown mucus.
yes, and pain here, especially in my chest. I'm really worried about this problem because...
You had a wheeze? Like a wheeze, like that kind of noise.
Yes, I have it now. Every time you see?
Can I have a listen to your chest again?
Yes.
The X-ray was clear.
Clear, so it is good news.
Very good news. Deep breath in now. Okay. Very surprised by the chest X-ray. It sounds like you've got an awful chest infection.
Yes,
But nothing's coming up on the X-ray.
How is it possible? Maybe they have made a mistake.
One thing though, credit to you, you always smile.
I got no choice. I have a job where I have to smile.
You nice smiley boy. You are.
Here, look up here.
So I don't know you at all, do I?
No,
So I feel as if I have met you, but it's because you gave me such a lovely smile. Oh, thank you.
Oh, okay. Near left you a present there. Okay.
Does she smile?
Yeah.
That's good.
You're doing well. The smile is back on your face. Very nice.
Eva? Hello, Poppet. You coming to see me? Yeah, come on down then.
You need to give me that back now.
But she's so much better at using it than we are, isn't she? Come and sit down. And what's your name?
Eva.
Hello, Eva. How old are you?
I don't know.
You don't know? All right. Are you 15? 4? Does 4 sound more like it?
Yes.
And I'm Dr. Bolger, and how can I help you today?
I have a cough.
You have a cough. Okay, and when did this cough start?
I'm talking a couple of days ago.
Temperature?
Not that I've noticed.
Okay. Do you think you can stand down in front of me? Would that be all right? Is she wheezy with this? With the cough, or just sound like a 20-a-day girl?
Yeah.
Shall we have a listen to your chest? How do I do that? Do you know? No.
That's your ears.
That's your ears. I do really well to hear your chest through there. Does Mummy want to bring you across and we'll sit you on the couch? Do you need a hand? I think you might need a hand. Fabulous. Now can you lift that lovely yellow T-shirt up, do you think? That's brilliant. What a clever girl. Do you think you can go, let's all do it. Should we get you down and put you back together again? Oh, careful. Visions of you ending up flat on the floor. So,
What you can hear is stuff in the upper airways, not actually on Eva's chest.
Yeah.
I suspect that she's picked up a virus that's given her a viral cough. She doesn't have an infection. I can't see anything to give her antibiotics for. But we know that she has asthma, so the sensible thing while she's coughing is to add the Ventolin to the brown inhaler.
Right, okay.
And then see how she goes. Having said that, if she becomes unwell with it, then we definitely want to see her sooner rather than later.
All right,
I think you can have your phone and I think you can go, because you were rather a star, weren't you? Yeah?
Little madam.
Bye-bye, sweetheart.
Bye.
Please don't drop that phone.
I know, it's gonna happen.
Bye-bye.
It doesn't quite fit, does it? Because what I was wondering is sometimes you can have a normal chest X-ray, but you might have, so maybe you've developed asthma later on in life, right? But you wouldn't expect to find the crackles, you'd expect to find a wheeze, which I couldn't hear. Let me just see something. My main concern, having assessed Tudor was just making sure that I wasn't missing other possible diagnoses. I still thought that this was most likely a bad chest infection, despite the chest X-ray findings. The other thing that I wanted to exclude was a pulmonary embolus. A pulmonary embolus is a clot that shoots into the supply of the lungs and can block off the ability of part of the lung to work properly. Not coughing up any blood?
Blood, no. Only mucus.
I'd like to do a blood test.
Okay.
It's not a blood test we use very often, something called a D-dimer. It can point towards a direction of other kind of problems, like clots and things. I just want to make sure it's not that, so we use it to exclude it, because if the D-dimer is normal, then we don't have to worry about it. So let me just see if they're available to do the blood. Just stay here for a second, okay?
Okay.
If you bring your stuff, you come with me, we'll do the blood test now.
Okay.
Still got like 5 hours of work to do.
I'm just taking a note.
How do you feel about that? Pretend I've got a microphone. How do you feel about that? Wonderful. How do you feel about working with me tonight? Terrible.
Morning, Mr. Gums. Come right in. Just take a seat. This is Priyanka, who's a student sitting in with me today,
Okay.
if that's OK with you.
That's all right, no problem.
Good. How can I help?
Yeah, Wednesday I was putting around in the house, yeah, and all of a sudden my knee it's got pain in it, yeah, and today I can't hardly bend it.
Is it swollen?
No, that's the thing. It's not swollen.
And it just started out of the blue?
Yeah, out of the blue, just like that.
You didn't
Wednesday-
twist, you
No, I
didn't twist it
I
around
didn't
like
knock it,
that.
nothing.
And so, what about sleep? Are you managing to sleep OK, or is this...
Yeah, as long as I keep my legs straight.
OK, but if you bend it at all?
Yeah, if I bend
Okay.
it, it's just in the...
So if you can just slip off your shoes and socks and just pop yourself over here and we'll examine
I
it.
started using ibuprofen, but I went to this pharmacy to get some pills. She asked me, she said, don't, because I'm on warfarin. You see?
Oh, are you on warfarin?
Yes,
OK.
Yeah, so she gives her paracetamol.
And so did you take some paracetamol?
Yeah, I took something yesterday.
So just if you can lie over here for me. What's your job? What do you work at?
Social care worker.
Ah, right, OK. So you don't do that much kneeling down or anything?
No.
Just lie back. So just bend it up for me as much as you can bear. Yes, right, OK. Is it up here or down here or around this side or just under it?
It's more near the bottom.
On the lower half?
Yeah,
right,
yeah,
right
it's
here.
around there, yeah.
OK, yeah. Can you feel that creaking in your knee?
Yeah.
OK. Can I just let Priyanka feel it? So you want to just come over here, Priyanka, and just put your right hand on that. So can we just get you to do it once more? OK, I don't want you to cause pain. Oh. Slowly straighten it out. Can you feel that creaking sensation?
I can feel it on the way up.
All right, OK. That's crepitus, OK? They likened it to a creaking sensation, and it indicates usually inflammation in this setting. And this is inflammation of the undersurface of the kneecap as it rubs against the femur. Good.
That's what it is, yeah? Okay.
Yeah, it is, yeah.
All right.
The reason I got Priyanka to feel Calvin's knee is that there is no substitute for hands-on experience. I wanted her to feel crepitus so that she would recognise it again. Textbooks describe crepitus, but there's nothing like hands-on experience. Ideally, the treatment would be a non-steroidal anti-inflammatory, but you can take those, and you absolutely shouldn't be taking ibuprofen, unfortunately. So what can you do? Well, you can take other painkillers just to relieve the pain, and you can put ice on that knee, and it'll settle down if you rest it.
It's really bad getting out of bed this morning, too.
I'm going to give you some codridromol just to reduce your level of pain. But remember, painkilling medication is just to reduce pain. It's not going to heal this. What's going to heal it is rest, elevation, and ice. And that's in your hands.
Okay, right, yeah. I will, definitely.
Good,
Thanks, Dr.
You're welcome. Yeah,
Thanks
nice
a lot.
to see you.
Bye-bye.
Bye.
Yeah, see ya.
I'm after a favour.
What's that?
Can you stay any longer today?
No, I really can't because I'm moving cows. I've got somebody coming to pick some cows up. I'm sorry.
No, that's all right. I'll keep asking.
Sorry, mate. I would have done normally.
Don't worry.
OK. I can help.
Jonathan, do you want to come through?
You know what? And I really appreciate everything you're doing, yeah?
Yeah.
But this is so much agony. There's no point having an X-ray. I know nothing's broken, but
No.
I swear to you, it's getting worse. It's a sleeping. I don't want to be signed off work. It's just no point.
Yeah.
Because my work says, like, if you really want to be signed off, but I'm like, there's no point because I can't sleep. I'm not depressed because I'm a strong human being.
Yeah.
And I really am. I'm getting fed up. Not with doctors, but...
This is just getting to you.
It's just so annoying.
OK. Well, I will have another look at your medication.
Is there anything else you can recommend?
I mean, you might think about maybe trying an osteopath to do a little bit around your neck.
Are you from around this area?
Yeah.
Do you know anyone where you can recommend? Not for free, I'll pay for it.
Yeah, unfortunately, osteopath.
No.
There is an osteopath clinic
Oh, where are
in
you
Maidenhead, and I've forgotten the name of it.
Ask at reception.
Ask at reception.
I bought some new pillows.
Yeah.
They cost me like 60 quid.
Yeah.
And I feel they're bouncy,
Yeah.
but firm, and I feel my neck a little bit more movement.
Yeah.
So there's no pain on my shoulder now.
No,
it's just here.
It's just down there.
It's just there. But I'm worried, obviously, you're a very busy man, so...
Shall we get on and do some of the acupuncture?
And last question, is there anything you would recommend, anything, to just get me sleep at night?
Get into a position that you feel most comfortable in. Make sure you don't have any tea or coffee to drink for about 2 to 3 hours before you go to bed.
Okay.
Or if you do, make it decaf.
Yeah.
And try not to eat for about sort of 2 hours before you go to bed. Right, so if you just come around a little bit for me, that's it. Great. I mean, you did get a fairly good response the last time.
I just wonder, if this doesn't work, how long can this go on for you?
Well, we can do 3 or 4 episodes of these and see how you get on. Now, I'm just going to go quickly up, make a cup of tea, and when I come down, I'll take these out of you.
Thank you.
OK? So don't go leaning back, because good
I
ways.
can feel it working.
Can you feel a little bit or something?
There's no
Good.
spasm.
OK. Let me just get this cup of tea.
Thank you.
See ya.
So you've had some surgery done, have you?
Yes, I have, yes. I had the carotid artery. Oh, where do you want me?
And then you can, that's it, rest your head back. That's lovely.
You relaxed? Yeah. Good. She's very stoic. Oh.
Do you know how many clips are in there?
About 25, 26, something like that.
Yeah, it's going to be very tender for a while, isn't
I've had
it?
staples out before.
Some of them are, you have to go quite deep down, but these ones are good.
Yeah, all right, Mum. Yeah, just holding my head. That's a tough one.
Yes. You can feel it. We'll go back to that one.
So what exactly did they do?
The main artery was over 70% furred up.
Oh, God.
So they cut her open, cut the artery open, cleaned it all out, stitched it all back up.
Oh, wow.
And she was out in 2 days.
Oh, wow.
Yeah.
Fantastic.
She was a strong girl.
Yeah.
Girl? But I should be 80 next birthday. But they said she was a major stroke waiting to happen. Wow. So thank goodness.
Yeah.
Thank goodness she had the little one.
It's that one, so we just have one more. This little one. Sorry, sweetheart. That's it. No bleeding. I'll just give it a little clean.
Leave one in.
No, they've all gone. I can assure you.
Oh, you take them home if you want.
I've had them long enough since. Thank you very
All
much.
right then.
Thank you, Kelly.
Thank you, you're welcome. Bye-bye.
Thank you, bye-bye.
Morning. All right. That was quick. Right, let's get these out for you. Okay, that one. That one.
You're the most helpful person.
Well, thank you very much for sending it. I mean, I think everybody here is pretty helpful, but people have different expertises and interests. That's them all.
Oh my God. I don't know what that does, but my elbow is no pain. Oh, that is heaven.
Is that better?
Yeah, I can know
Oh, good.
I can move it like
Good,
that.
good. Well, that's good.
I find myself in bed.
Yeah.
Regularly, I find myself sleeping like that.
Yeah.
To try and not move it. Oh, that's heaven.
Yeah. And unfortunately, the good thing is to move it, because the more it spasms, the worse it gets. That's the problem.
That's right, thank you very much.
There you go.
Cheers.
Right. Well, good. So we'll try and do something on Monday for you.
Oh, so reception run about.
Yeah.
Thank you, Peter.
Not at all. My pleasure, Jonathan.
If you would take an incentive, I would happily pay you.
Don't worry, mate. Thank you very much. That's very kind of you to say.
Thank you.
I'm glad you've got some benefit.
Cheers.
Cheers then, Jonathan. All the best.
People keep phoning me trying to sell me things and make me do things.
I'm not interested.
I've been trying to contact you about your PPI. I've never claimed PPI.
They line my husband up, actually, and when he answers the phone, they go, oh, you had an accident? He said, oh, yeah. Just let me know where it was and when it was, and I'll claim for it.
How can I help? 13th of this month. Yeah. 10 days ago, I had a hernia, spigoidin hernia repair.
Okay.
It was keyhole.
Yeah.
And I got about 10 or 12 little incisions. Yeah. And yesterday morning, I was awake all night, Saturday night, and I was laying there yesterday morning thinking, sorry, what's wrong? And I was laying like that, and I've got a bit of a lump under one of the incisions. It's almost the size of an egg.
Okay. But let's check your blood pressure. Okay, check your temperature. Okay, temperature is fine. Okay, so if you can slowly come down this way. Right, should we have a look?
A little bit there. Oh,
that's all, is it?
Yeah. It's all there.
Is this the one you're talking about? Yeah. It's around the site where the laparoscope instrument has gone through. Yeah. That's where it is. So, so there is a mark there too, and I can feel the lump under that mark. Yeah, that's sore as well, isn't it?
So is it tissue? Or...
So yeah, sometimes what happens is what we want to rule out is a bleed under the under the wound, okay, which we call as a hematoma. But it's a slightly bigger than what we normally would see. So I think what you might need an urgent ultrasound.
Come in. All the best. Bye. Hello. Got a great old knock there.
Come in. Ta-da! Do you know, I actually got excited about this. Did you? I did. Just a little bit.
Come in. I've got a skin thing that I'm completely befuddled by. Okay. So I'll come. Thanks.
Come in.
Hello.
Hello.
Have you done a prescription for an Andrew? Aaron, yes, that's the one. Thank you.
Sorry.
No, that's all right.
Thank you.
Thank you.
Come in. I'm not doing telephones. It's like time to practice in Piccadilly Circus today, isn't it? Hello, can I take a seat? I'm Dr. Allen. What can I do for you?
I've had a really bad ear in the night, and it really hurt. And when I woke up, there was blood on the pillow, and it was bleeding as well, and I don't know.
Has the pain improved since
The pain has
bleeding?
improved, yes. But I flew back from Spain on Sunday. I don't know if it's the pressure of the blood on that.
Oh, yuck. Oh, it's oozing away, isn't it? Okay, right. So there's no drum whatsoever in there. Lots of bubbles and blood.
Right.
So I think we're going to treat this as an infective cause.
I feel a bit lightheaded. I've got a bit of a cough and a head cold.
You will do, because your ear is your balance mechanism, and when the drum goes, 1, you go deaf, and 2, you feel very unsteady.
If I go swimming and I get water in it, I'm in agony.
It's bizarre. It's like honeycomb, but with fluid in it. So what we're going to do today is put you on some antibiotics. You need to keep the ear dry, so when you have a shower, pop, like you had, cotton wool in there to stop the water getting in.
Oh, it woke me up. It was really painful.
Well, it's like having a balloon with the pressure rising.
And then all of a sudden it went goo, 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 and then I looked on the pillow and there was blood on it. I thought, oh, Christ, when you're bleeding from the ear, you know, you should think to yourself, you know.
The end is nigh, yes. So, the antibiotic is amoxicillin. Hang on! 1 tablet 3 times a day for a week. Right. Keep your ear dry. I need to book you in for 10 days' time. 1 minute. Oh, it's a lady with important things. Do you mind if I get my tea and cake?
No.
Oh, you know what I'm having.
I know.
Thank you. Thank you, ladies.
Oh, gosh,
thank you.
No, I can't have them because I go to the Healthy Heart.
Oh, right.
What Dr. Joanji done for us, and I've got 2 more weeks of that to do, and tomorrow we start doing the gym work.
OK, well, let's see if this heals, and then we'll take it from there.
Thank you very much,
Take
anyway.
care of yourself.
Thank you.
All
Bye-bye.
right, bye-bye.
I was in KFC yesterday, right? This guy behind the till, he was like, whereabouts are you from? Because you sound like someone from Jersey Shore. I was like, what? Oh, no, made in Chelsea. Where's that? Where's Chelsea?
London.
They talk really posh. So do I.
Hello, hi, is that the surgical registrar? Yeah, hi, Dr. Sheikh here, one of the GPs. Just wanted a bit of advice. I wanted to discuss about a patient, 50-year-old lady. She had a laparoscopic right vigilant hernia repair just 10 days ago. She has noticed a painful lump at one of the incision sites. No sign of infection. I don't think there's an infection, but the lump is a bit worrying too. I think she needs to be seen, yeah. All right, can I send her through? Thank you, yeah, bye. So are you okay to go straight from here?
Yeah.
And your heart rate is slightly high as well.
Is it?
That can sometimes be due to pain.
Yeah, what was it?
It's 100.
100?
Are you stressed? You've been thinking about it?
Yeah.
I think you must be worried about the lump. It's unusual, and it's probably just getting your heart rate up a little bit. And you're in pain at the moment, so...
And you're in pain as well, yeah. OK, so if you take this letter to A&E, and they would call the surgeons to see you in A&E.
Oh,
OK, all right? No worries, take care. And I hope everything goes well for you today.
I'm sure it will. If
All
not,
right,
I'll have
take
to
care.
punch her. Thanks, Doctor.
Thank you,
Thanks very
bye.
much. Bye-bye.
Can I make an appointment for my sister, please?
Was Dr. Bolger, yeah?
Is indeed, yeah. She's a popular woman, isn't she? I always say she's a bit like the Wizard of Oz.
Yeah.
We went to see that Bridget Jones's
Oh, was it good?
beer book. He wanted to see a diary.
I did see the other 2, so I just wondered if it was silly or, a bit too silly.
It's not too silly, no.
Oh, that's good.
No.
Have you seen the recent Panorama program about diabetes, the hidden killer? No?
I must admit, I did like Hugh Grant in it as well.
Yeah, he's not in this one, no.
He's in it, though, isn't he?
Colin Firth.
Yes, he's
Colin Firth's in it, yeah.
Colin Firth is lovely, though, isn't he?
Okay, how can I help today?
I just had my blood pressure done, and then the pharmacist said to come and have a chat with you about it.
And what did they say to you about your blood pressure? And...
It was a little high again. Yeah.
Have you known to have high blood pressure before, or...?
It was high like 10 years ago.
Right.
And it's been good ever since. But
That's
we've had a
brilliant.
lot going on in the family this year, so...
Okay, I'm sorry to hear that. Is that to do with your immediate family, or...?
Yes, we've had 7 deaths in 5 months in the immediate close family members.
Oh, I'm really sorry to hear
So
that.
I'm not surprised
So you've been
that...
through so much.
Yeah.
So no wonder you're
Yeah, I'm not surprised that it's all over the place at the moment.
Have you had strokes, heart attacks before? Nothing like that?
No.
Known to have any high cholesterol?
Yes, I suffered high cholesterol.
Okay. And anything in the family, like any type 2 diabetes, heart attacks, strokes, anything like that in the family?
Oh, yes. My dad had high blood pressure. He had a stroke. My mum had a stroke. She had heart problems. She was diabetic. My sister's diabetic. She has heart problems.
So it's quite, yeah.
So it's in the family.
It's in the family.
Yeah.
The simple matter is we just start you on one tablet at the beginning to see if we can control your blood pressure, because obviously the 10-year risk of having high blood pressure are things like, unfortunately, heart attacks and strokes. So we need to minimise your risk because you've obviously got the family history. And we need to do the urine dip and the ECG. Okay. Oh, you've done the ECG. Your ECG was normal. So the only thing now you need to do is book in with a nurse in a week to get the urine sample. Should we do your...
Yeah, because I mean...
And then just relax your arm like that for me.
My problem is that there's 3 people at home that depends on me.
Right. Who do you live at home with?
My son's epileptic, so I'm his carer.
Oh, my goodness.
And then he's got twin 6-year-old.
He's got twin 6-year-olds himself, right?
Yeah, and one's type 1 diabetic, and the other one's ASD.
Autistic.
Oh, he's autistic.
Spectrum disorder.
Yeah, and I suppose I'm just a little bit stressed.
So no wonder all the stress is just... Right, just try and take deep breaths.
My brother-in-law died, and then like a month later my mum died. She had to go to the Caribbean, and while we were out there, her cousin died.
165/85. So again, it is, and your pulse is weirdly low. Sorry, I'll take this one here.
Her friend died the week before we buried her, and the week after we buried her, her cousin died.
I thought Caribbean's going to relax the person. Oh my God.
And then the day I came back, I heard my dad's cousin had died.
Right.
So then, okay, no more.
God, goodness. I think we should really start the 5 milligram amlodipine because I think we're at that borderline, and with your really strong family history.
Yes, I think we're better.
Yeah. And in a week's time, the nurse will recheck the blood pressure to see is this tablet working on you.
Okay.
If your blood pressure hasn't come down within a week, we know it's not the right. Either we increase the dose or change to a different tablet. Is that okay?
Yeah, that's fine.
Perfect. Oh, did I give you the prescription?
Yeah, I've got it in the
lovely.
bag.
Take care.
Thank you very much.
Bye.
This is my Mandy, your mum's friend, Vivian.
Oh, okay.
Yeah.
Hello, I've just been for an ultrasound and they've given me this report to give back to
I don't want it.
my friend Dave Ward.
Is your friend, is he?
Yeah,
Cool, you're one of the few, are you?
I like him.
I know, so do we, darling. Hello, here's my friend. How are you? Come on, let me have the chair up, please, so I can see you. There we go. That's better. I love your wheelchair. I think it's brilliant.
Mrs. Brown? Hello.
Hello.
I'm Barbara.
Nice to meet you, Barbara. You've got one nervous patient here.
You'll be fine. Just remember to breathe.
To breathe?
Yes.
Yes.
Don't hold your breath. Breathe.
Just
and
breathe.
It'll take just a minute and we'll be done.
Correct me if I'm wrong. Are there 2 sizes of the
speculum?
Yeah.
There are actually 4 sizes. It's no more metal. When you did before, it was a metal, a cold metal. It's a plastic that I run under warm water, so it's warm. It's not cold anymore.
Okay.
And I promise I will not hurt you.
I've got every faith in you. I just think it's very, very important that we have it done.
Yes, it is very important. And I'll make sure I tell you what I'm doing, so you're not nervous.
Okay.
All right. It is a screening test, so it's not a diagnostic test. So what I'll do is I'll take a sample of cells and I'll send it off to the lab. At the lab, they'll check for any abnormal changes within the cells. If there's any abnormal changes, they do a further test on the sample called the HPV test.
Okay.
So HPV stands for human papillomavirus. So I'll pull the curtains around you. take your lower bits off for me.
Yes.
And get on the bed. Give me a shout when you're ready.
Yes.
And I'll do this.
Okay.
Okay.
Will do. Thank you, nurse.
Okay.
Thank you very much. Oh, these are much better, aren't they?
Yeah. I put this here so you can put your trousers and stuff
Lovely.
on.
Thank you, nurse.
All right.
Thank you. You'll have to really excuse me if I'm a baby.
You're fine. Trust me.
Oops, a daisy. There you are.
Can I come in?
You may.
All right.
Is that okay?
Yes. You feel my hand first. Okay. And then let's back on. Remember to breathe for me. Sorry. Well done. That's the hardest bit done. Relax. Okay, try and relax for me. What do you like doing?
I like jigsaw puzzles, and
do you?
yeah, they're my favourite.
Sorry.
Oh, I know you want me to relax, but oh no!
I am so sorry.
Your cholesterol tablet, are you not taking them?
No, I'm not.
Why is that?
Because I'm getting forgetful in my old age.
You're only 49. You're not old.
You know how I found that I was low on vitamin B12?
No.
I kept on forgetting things.
Do you want it written down? Yes, please, because I will forget, because I've got so much to do today for tomorrow.
I fell down the stairs last year. I lost my memory for nearly 4 weeks.
Oh, gosh. It's the worst, isn't it, the baby brain?
My other sister, she's pregnant, and my God, her baby brain. I'm just like, I just told you that.
You're taking 2 sorts of tablets for your diabetes, yeah?
I skip sometime, not every day.
Why? Why'd you skip?
I forget.
Oh, okay.
How can I help today?
Yesterday, I noticed I've got a gash on my leg. Now, I don't remember banging it, but the way my legs are feeling recently is if I even trod on a nail, I don't think I'd feel it. They feel like
You've got diabetes, haven't you?
border.
OK. It's not looking like it's spreading anywhere.
Right.
It looks like it's all kind of staying in one place, which is what we want it to do.
Do you think, in your observation, you think I've knocked it?
It looks like you may well have done, without perhaps realising it at the time.
Yeah, because when you're younger, you hit yourself and you go, and of course... But I'm getting older, so I'm forgetting things, but I don't remember banging it.
Sure.
Not
OK.
at all.
In patients with diabetes, wounds can often tend to heal quite slowly, mainly as a result of impaired circulation and nerve damage. And the risks of this ultimately are long-standing infections, gangrene, ulceration, and ultimately amputation in some cases.
Look how swollen I've become. Isn't it terrible?
Okay. Is it the same both sides?
Yeah, both sides,
Swelling-wise?
yeah.
OK.
Since an operation. All the scabbiness and the dryness. Now I can't bend to grease my skin, whereas I did before.
Oh, right, OK.
My kids are half Indian, half black, so oiling my skin was a natural phenomenon. But
Yeah.
I can't do any of that now.
You mentioned that you can't reach. Is there somebody that could?
I've only got a 21-year-old boy at home,
OK.
and him being a young fella, I can't say to him, can you grease me?
Why not?
I think that if I asked him to do it, I just don't know, I just feel too embarrassed to ask him.
It looks dry, and when skin is dry, there's a chance of it cracking, and when skin cracks, infection creeping in. So the win-win situation here would be getting somebody to perhaps apply some decent emollient on a regular basis.
Really?
Can I prescribe you some?
Yes.
So that you've got it.
So I've got it. Then if someone comes, I said, just
Yes,
stick that on.
absolutely. Yeah, absolutely. There's 2 things I'm going to prescribe. The small antibiotic cream for the slight kind of abrasion there.
Yeah.
The other one is a tub of emollient.
Yes.
This one comes in the form of a gel.
Must be something new. That's amazing.
That's all done for you.
OK, sir.
All right.
And you.
Nice to
Thank
meet you.
Nice to meet you, sir.
Take care.
See you again. God bless.
Bye now.
I am so sorry.
Don't be sorry. You haven't seen me getting mine done.
I'm going to
like
put-
a chicken, screaming all over the place.
Was you nearly there?
Yes. So I've got gel on this to make it easy for you, OK?
OK.
All right. Relax. Deep breath for me. There it is. I'm so sorry. I have found it. Remember to breathe. I'm going to take the sample.
Oh, dear.
I know.
That is the most uncomfortablest thing I've probably ever had, but I don't care how.
I am so sorry.
Oh.
So I'm done.
You done it?
Yeah.
Did you get one?
I did.
Oh, I'm so sorry.
Don't apologise. It's only natural.
Barbara, I can't thank you enough that you've managed to do it. I really can't.
You are fine. And you're welcome. If you don't come, I don't have a job.
So I just wait now, Barbara,
Yes.
to hear if...
If there's anything, they'll call you on the telephone number you've given me and they'll refer you on for treatment. If everything is okay and no abnormal cell is found, you have your result as a letter to your home address within 3 to 4 weeks.
Yeah.
And the hospital will decide whether we see you again or this will be your last
And if they do want to see me again, I'm going to say that I want Barbara there.
Oh, thank you.
Thank you very much, Barbara.
You're welcome.
Really appreciate it.
You're welcome.
Thank you very much.
You're welcome.
Very kind.
Thank you. All right. Bye-bye.
Is that scribbling?
It's scribbling, yeah. It's my neat writing. Takes a long time to learn how to write like that. All right. See you later. Take care. I absolutely love my job. I couldn't see myself doing anything else. I genuinely enjoyed getting to know my patients, knowing everything about them, all the ins and outs and what makes them tick.
It's been a good relationship between us both. Well, I've enjoyed it.
Good, so have I. It's been a pleasure looking after you. I can remember sitting in my GP surgery, aged 8 years old, not feeling very well, and the GP telling me what he thought was wrong with me and what was going to happen. And I just remember thinking, wow, that must be great.
Best thing about being a GP is that you are given insights into patients' lives that they will not necessarily give to anybody else, and that's a real privilege.
There's always challenges, there's always surprises, and it's just never the same thing every day, so it's just such a worthwhile job.
Quite happy today, I'm quite surprised.
It's because I'm positive again.
Good.
I've had 6 months, but I'm just got with things. See you later. Bye-bye.
When I wake up in the morning, I feel great to come to work. Very few people can say that. You're a great survivor.
I keep going.
We enjoy the work, despite how hard it is. We enjoy going home at the end of the day, like everybody else, knowing that we've probably helped a lot of people. I don't know any GP, particularly those I work with, who don't feel that to be the case.
Bye-bye, dear.
Thank you. Well, dear.
Where are you?
Thank you. Well, have a nice day, doctor.
Yeah, and you.
Thank you, doctor.
Bye-bye.
Being a GP is absolutely a vocation for me. It is the reason I breathe, it's the reason I live, it's the reason I get up in the morning, and it's the reason I go to bed at night contented.